please. Who cannot join the Zoom, they can officially join a YouTube channel of Universitas Muhammadiyah Lamongan. Then second, when joining the room, please rename your account name in front, name _ institution or affiliation. Third, participants who join the Zoom are requested not to activate the microphone feature during the webinar activity. So please unmute the microphone. And the fourth, filling out the attendance list only once at the end of the event. And all the participants who take the webinar via Zoom or YouTube can ask questions on the Zoom or YouTube checkbox by typing name, institution, and the question is addressed to whom, and what is the question is. It is permissible or allowed by English language or by bahasa. And the moderator will deliver it to the speaker during the discussion session. Next, questions that are considered almost the same will only be read once. The maximum questions for each speaker is 2 questions only. And the certificate will be given to participants who took part in the event from the beginning till the end of the webinar, and registers and fills in the attendance list, of course. Next, the participant certificate information will be conveyed by WhatsApp, Telegram, or Line. And the attendance list will be shared by the moderator at the end of event and given opportunity to fill the attendance list until 3 p.m. While the material link will be shared at the end also of this webinar by the moderator or master of ceremony. Those are the rules of this international webinar. Okay. And I will say hello to Professor Dr. J.N. Ahmad from Mahsa University, Malaysia. Hello, Professor.
Can you hear me?
Yes.
Thank you.
Hello, Prof. How are you?
Yes, fine. Alhamdulillah. Assalamualaikum.
Alhamdulillah. And I will say hello to Professor Dr. Hanita Muntabut from KQ University, Thailand. Hello, Prof.
Thailand. Good morning.
Good morning.
Kenapa gambar I tak dapat? Sayang? Gambar I selalu tak boleh.
Dia kena masuk. Dia kena masuk. Invite you lah.
Dah invite lah. Can you see my picture?
Not yet. Not yet.
Dia lupa saya tu amal.
Ini partisipan, ni memang dah in.
Good morning, Hanita. Good morning, Prof. J.
Ni orang semua nampak I punya.
Ha?
Cuma tengok. Semalam pun I cakap dengan ni.
Masuk Hanit ajar ni.
Ni dia boleh masuk.
Sudah ganti tadi.
Dia kontrol bawah tu saja.
Ni boleh.
Pintu tak. Tak ada.
Ni dengan Anik cakap. Ni memang dah ada.
Participant. You are in participant.
Ni? Anik.
Nak ada. Mute. Move. Dengan mute.
Rename anak, rename Cik An.
Paling apa?
Edit profile. Ni ke? Ni ke?
Kamera
Tak dapat.
Kamera ni.
Kamera.
Mana yang?
Ni gambar. Mana nampak? Hai gambar tak dapat. Alung tahu tak? Berapa kali?
Itu dia.
Bila kita nak cakap, kita ambil.
Hah?
Bila kita nak cakap,
Cakap you cakap je. Because you dah participant.
mute.
You test raya. Ada orang dengar tak?
Gambar I tak boleh masuk. Sini. Gambar ni tak boleh masuk. Cuba
And
tanya.
also I will say hello to Bapak Dimas Arya Nugroho, Sarjana Terapan Kesehatan, Magister Kesehatan from Universitas Muhammadiyah Lamongan. Halo Bapak, good morning.
Good morning.
Thank you.
Udah dibilang tadi sama Mak Osi, tunggulah Mak Osi, aku bilang. Sama Mak Osi lah aku tadi. Sama aku katanya. Kalau langsung aja aku ke AWK dan selesai langsung aku kasih. Kemarin gitu.
Well, let's start our international webinar today. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Alhamdulillahilladzi arsala rasulahu bil huda wa dinil haq liyudhhirahu 'alad dini kullih wa kafa billahi syahida la nabiyya ba'da. Good morning ladies and gentlemen. Selamat pagi dan salam sejahtera untuk kita semua. Welcome to our international webinar. Thank you for joining our international webinar entitled The Role of the Health Workers in the Midst of COVID-19 Pandemic and New Normal Era, that's organized by Faculty of Health Science, Universitas Muhammadiyah Lamongan. I'm Faiz Wahidatul Arifatin as a Master of Ceremony for today's international webinar. By saying Basmalah, let's start our international webinar. Bismillahirrahmanirrahim. Hopefully, our today's agenda runs very well. Amin. First of all, I would like to greet Director of Universitas Muhammadiyah Lamongan, Bapak Dr. Andes Haji Budi Utomo MKes, the Dean of Health Science and Faculty, Bapak Arifal Aris, SKEP and SMKes, our faculty members, our honorable speakers around the world, and all of our beloved participants. Let's thank to the Almighty who has given us chance to meet in this occasion through this international webinar. Then salawat and salam to our Prophet Muhammad sallallahu alaihi wasallam. Allahumma sholli wa sallim. Next, here we will show you about our vision and mission from Universitas Muhammadiyah Lamongan and Health Science Faculty. Our vision of university is to be an innovative, professional, and Islamic university. And our missions here are organizing a good quality of education based on Islamic values.
Maaf, suaranya hilang itu. And salawat and salam to our Prophet Muhammad sallallahu alaihi wasallam. Allahumma sholli wa sallim alaihi. Next, we will show you about our vision and mission from Universitas Muhammadiyah Lamongan. Here are the vision of our university. To be an innovative, professional, and Islamic university. And our missions here are organizing a good quality of education based on Islamic values, conducting an innovative research for the advancement of science and technology, industry, and health and the benefit to people, conducting a community service based on the health industry. Next, providing a moral religious basis for the development of science, technology, and art, as well as the fostering of faith and piety in the context of Islamic da'wah, amr ma'ruf, nahi munkar. And the last one, building a trust and developing the cooperation with various parties to improve the quality. And our vision from Faculty of Health Science to become an excellent Faculty of Health by promoting the development of innovative competencies based on Islamic values. While our missions here are, first, developing higher education in the field of quality health science with national standards based on Islamic values. Second, conducting an innovative research in the field of health science that is utilized for the benefit to people. And organizing and carrying out community service through a cross-program and a cross-sector approach. The last one, developing active cooperation with higher education and related national and international institutions. So those are our vision of and mission from Faculty Health Science Universitas Muhammadiyah Lamongan. Then, before going to the main agenda, let's hear a welcoming speech from the Rector of Universitas Muhammadiyah Lamongan. To Bapak Dr. Andes Haji Budi Utomo MKes, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Alhamdulillahilladzi arsala rasulahu bil huda wa dinil haq liyudhhira 'ala dini kullihi. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh. Allahumma sholli ala Muhammad wa ala ali Muhammad. Amma ba'du. The Honorable Professor Dr. Kian Ahmad, Deputy Dean Faculty of Nurse and Midwifery, Mahsa University Malaysia. Associate Professor Dr. Hanita Muntabut, Director of Doctoral Nursing Study Program, KKU University, Thailand. Associate Professor Dr. Saira, Dean School of Graduate Studies, MSU University, Malaysia. Dr. Quratul Aini, Magister Kesehatan, Master of Hospital Administration Program, Universitas Muhammadiyah Yogyakarta. Dr. Apoteker Endang Yuniarti, Sarjana Sains, Magister Kesehatan, Farmasi Departemen PKU Muhammadiyah Hospital Yogyakarta. Dimas Arya Nugraha, Sarjana Terapan Kesehatan, Magister Kesehatan, Lecturer of Physiotherapy Studi Program, Universitas Muhammadiyah Lamongan. First of all, let us praise and thank Allah SWT for this beautiful opportunity to gather and attend this international webinar of the role of health worker in the midst of COVID-19 pandemic and new normal era, without any obstacles and in a good condition. Second, my salawat and salam be delivered to the Prophet Muhammad Sallallahu Alaihi Wasallam. Ladies and gentlemen, we welcome you to our beloved campus Universitas Muhammadiyah Lamongan. Hopefully, we can cherish and always remember our first meeting. Please do remember that our campus is still relatively new and in attempt to catch up innovation. Therefore, hopefully we can continue to hold this kind of activity so that it can make a very valuable contribution to this university. Today's webinar is focusing in the COVID-19 pandemic, which can be learned from many different aspects. Ladies and gentlemen, as the person in charge of this activity, I do hope this webinar can give us motivation and inspiration in gaining extraordinary knowledge from our speakers who have a lot of experience with COVID-19 according to their capacity and competence. Last but not least, this event might have some technical error and other obstacles. I do apologize for the inconvenience that might come, and I do not forget to send my best gratitude to all the speakers who have been willing to share the knowledge and experience for all of us, despite the tight schedule that they have. May Allah always give us the light and guidance. Amin, amin, ya Rabbal Alamin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Bapak, for warm welcoming speech. And the next speech is opening speech from the Dean of Health Science Faculty, Bapak Arifal Aris, SKEP NSMKes, to Bapak Arifal Aris, SKEP NSMKes. Time is yours.
Oke, terima kasih. Assalamualaikum warahmatullahi wabarakatuh. the Honorable Director Universitas Muhammadiyah Lamongan, along with the Vice Rector, the all of international webinar speakers, Professor Dr. Jin Ahmad from Mahsa Malaysia University, Associate Professor Dr. Hanita Muntabut from KKU University of Thailand, Associate Professor Dr. Saira from MSU University Malaysia, Dimas Arya Nugraha from the Universitas Muhammadiyah Lamongan, Dr. Quratul Aini from the Universitas Muhammadiyah Yogyakarta, Dr. Apoteker Endang Juniarti from PKU Universitas Muhammadiyah Yogyakarta, the all of seminar committee and all of the seminar participant. Alhamdulillahi Rabbil Alamin wa bihi nasta'in ala umuridni waddin wa maulana Muhammadin wa ala alihi wa sahbihi ajma'in. I would like to say thanks you to Allah subhanahu wa ta'ala who always given us help, blessing and salvation so that we can gather virtually without trouble at all. Then I like to say thanks you for MC and the people here who have given me an opportunity to speak in front of you all. Well, I would like to say welcome to our international webinar on the role of health workers in the midst of COVID-19 pandemic and new era and new normal era. I would also like to thank to all the committee for their good cooperation in preparing this event and all participants who took the time to join in the seminar today virtually. Through this, I am asked the Dean of the Health Science Faculty at Universitas Muhammadiyah Lamongan, apologies if there are still many shortcomings in preparing this virtual seminar. Hopefully, this international webinar give a lot of benefits for the participant, including relation among university in order to conduct the other academic activity. Presumably enough, up here a little speak that I can say for all the mistake and said but less willing had your head, but of which I intentionally or not. I apologize profusely, then thank you for your attention and cooperation. Akhirul kalam, wabillahi taufiq wal hidayah. Salam, assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Bapak Arif Al-Aris, Asgat NSMKes, as a Dean of Faculty of Health Science, Universitas Muhammadiyah Lamongan. And our next agenda is praying that will be delivered by Ustadz Tatak Satria Praja, SPDI MPDI. To Ustadz Tatak Satria Praja, SPDI MPDI, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Before we start the seminar today, let us pray for a moment so that this event runs smoothly and we are given health and patience in the mind of this COVID-19 pandemic. Let me lead the prayer using the Islamic way. For those of other religion, please adjust to their respective beliefs. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan syakirin, hamdan naimin, hamdan yu'afi ni'amahu wa yukafi'u mazidah. Ya Rabbana lakal hamdu kama yang bagi li jalali wajhikal karimi wa azimi sultani. Rabbana la tu'akhidna in nasina aw akhtana. ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين ربنا اغفر لنا ذنوبنا وذنوب والدينا وارحمهما كما ربياني صغيرا اللهم إنا نعوذ بك من البرص والجنون والجذام ومن سيء الأسقام اللهم رب الناس أذهب البأس اشفي أنت شاف لا شفاء إلا شفاؤك شفاء لا يغادر سقما ولا ألما Oh Allah, give us smoothness in our seminar, give us patience and strength in dealing with the COVID-19 pandemic, and make us among those who surrendered to you. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Wassalamu alaikum warahmatullahi wabarakatuh.
Amin, amin, ya Rabbal Alamin. Thank you so much, Ustaz Tatak. And before I hand this webinar to the moderator, I would like to say thanks to Bapak Budi Utomo Enkes as the Rector of Universitas Muhammadiyah Lamongan, the Dean of Health Science Faculty, Bapak Arifal Aris, SKIP and SMKes, and also Ustaz Tatak Satria Praja, SPDI and PDI, for your warming speech, for your wonderful speech and the praying. Thank you so much. And I would like to inform you that this certificate will be awarded to all of you who joined the webinar until the last session. The link of material and also the attendances will be shared at the end of the international webinar. So, ladies and gentlemen, here are our international webinar that will be led by Ibu Isni Lailatul Maghfirah SKIP and SMKes as a lecturer of Health Science Faculty Universitas Muhammadiyah Lamongan. To Ibu Isni Lailatul Maghfirah SKIP and SMKes, time is yours.
Check. Can you hear me? Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, our dean, our speaker, our committee, and all the audience. I hope all of us in a good condition so we can follow this event well. Welcome to our international seminar, and our topic today is the role of health workers in the midst of COVID-19 pandemic and new normal. I am Isni Lailatul Maghfirah from Universitas Muhammadiyah Lamongan will be a moderator in seminar. For your information, this seminar will be divided into two sessions. There are three speakers. Okay, I'm sorry for the some mistakes. I will information about this seminar. This seminar will be divided into two sessions. The first session, there are 3 speakers, and the second session, there are 3 speakers too. The speakers in the first session are Professor Dr. Cian Ahmad. She is Deputy Dean Faculty of Nursing and Midwifery Masa University Malaysia. And the second one, Associate Professor Dr. Hanita Muntabut. She is Head of Nursing Postgraduate Study Program from KKU University, Thailand. And then the third speakers in the first session is Dimas Aryanugraha, Sarjana Terapan Kesehatan, Magister Kesehatan. He is lecturer of Physiotherapy Study Program, Universitas Muhammadiyah Lamongan. And then for the speakers in the second session is Associate Professor Dr. Saira. She is Dean School of Graduate Studies, Management and Science, University Malaysia. And then Dr. Quratul Aini, MKes, CIQR. She is responsible for the Quality of Management Study Program at Yogyakarta Muhammadiyah University Hospital. And the last one is Dr. Apotheker Endang Yuniarti, SSI MKes. She is an apotheker from Instalasi Farmasi Rumah Sakit PKU Muhammadiyah Yogyakarta. Okay, all of audience, before we start the topic, I will share the curriculum vitae of speakers, and each speakers will presenting the topic in 20 minutes. I will announce the speakers if the time is limited or over 20 minutes. And after all the speaker explain the topic, the discussion session will be opened and the participant can ask some question. After that, the committee will hand over the certificate virtually. Before we start our first session, I will share about our seminar rules in English and Bahasa Indonesia. Okay, this is the international seminar rules. I will share you on in the screen. Okay, this is our international seminar rules. Access the Zoom will be open 30 minutes before the event. It is about 8 AM Jakarta time and will be closed after 50 minutes. It is about 8:45. And then let participants are welcome to access YouTube Live or YouTube streaming. And then when joining the Zoom room, please rename your account name in the format name, your name underscores your institution. And then participants who join the Zoom room are requested not to activate the microphone feature during this webinar activity. So please mute your microphone. And then you can fill out the attendance only once. So you can only fill out the attendance only once at the end of the event. All participants who follow the webinar via Zoom or YouTube can ask questions in the Zoom box or YouTube chat box by typing the name and origin of the institution and the question to whom and what question. You can use English or Indonesian, and the moderator will deliver the speakers during the discussion. And questions that are considered to be almost the same will only be read one and maximum 2 questions for each speaker. And then the international seminar rules is the first one. The certificate will be given to participants who attend
who attend the event from the beginning to the end of the webinar and register and fill out the webinar attendance list. Participant certificate information will be conveyed to WhatsApp, Telegram, or Line group, and the attendance link will be shared by moderator at the end of the event and given the opportunity to fill in the attendance list until 3 p.m. And then the material link will be shared at the end of seminar by moderator or by master ceremony. And I will read tata tertib seminar in bahasa so you can understand well from tata tertib or rules in the seminar. Jadi akses masuk Zoom-nya akan dibuka 30 menit sebelum acara dimulai pada pukul 8 dan akan ditutup setelah 15 menit setelah acara berlangsung, kira-kira jam 8.45. Peserta yang terlambat hadir dipersilahkan mengakses YouTube Live atau YouTube Streaming. Dan saat bergabung di Zoom Room, bisa akun rename nama Anda dengan format nama, kemudian underscore instansi. Peserta yang bergabung dalam Zoom Room dimohon untuk tidak mengaktifkan fitur mikrofon atau di-mute selama kegiatan webinar berlangsung. Kemudian, saat pengisian daftar hadir, hanya sekali saja di akhir acara. Semua peserta yang mengikuti webinar melalui Zoom atau YouTube bisa mengajukan pertanyaan pada kotak chat box atau YouTube dengan cara ketik nama, asal institusi, kemudian baru pertanyaan ditujukan ke siapa, dan kemudian dilanjutkan dengan apa pertanyaannya. Diperbolehkan menggunakan bahasa Indonesia. Apabila kesulitan dalam menggunakan bahasa Inggris, moderator akan menyampaikan kepada pembicara saat diskusi berlangsung. Pernyataan yang dianggap hampir sama maka akan dibacakan satu saja karena sudah dianggap mewakili, dan pertanyaan maksimal 2 pada setiap masing-masing pemateri. Jadi mohon kepada peserta apabila bertanya silakan bertanya kepada pemateri yang berbeda apabila ada pertanyaan lagi. Tata tertib yang terakhir, sertifikat akan diberikan bagi peserta yang mengikuti acara dari awal sampai akhir yang melakukan registrasi dan mengisi daftar hadir webinar. Informasi terkait sertifikat ini akan disampaikan pada grup WhatsApp, Telegram, atau Line yang sudah dibuat, dan link daftar akan di-share oleh moderator atau oleh admin di akhir acara, dan diberikan kesempatan untuk mengisi daftar hadir sampai pukul 15 atau jam 3 sore. Kemudian link materi akan di-share di akhir acara oleh moderator ataupun MC. Oke, untuk tata tertib sudah saya bacakan. So, before we start, I will explain our speakers, okay, for the first session or for the first session in this seminar. The first speaker is Professor Dr. Cian Ahmad. Hello, Professor, can you hear me? Okay, Professor, can you hear me?
Yes, can you hear?
Yes, I can hear your voice, and I can see your video too. Okay, she is Professor Dr. Cian Ahmad.
Yes.
Yeah, she is Deputy Dean Faculty of Nursing and Midwifery, Mahsa University Malaysia, and the topic is COVID-19 among pregnant women. So before Professor Dr. Cian Ahmad share or describe about the topic, I will share the CV of Professor Cian Ahmad. Okay, this is the CV. Okay, this is the CV, and then the next one, this is the CV. You can see this one. There is so many service awarded, excellent service award, and then a working experience. It is her working experience. She was staff nurse in medical surgical labor and coronary ward for 8 years. And this is achievement position. And then this is achievement 2 for international achievement. And then this is the research publication. So there are so many research and publication from Professor Dr. Cian Ahmad. Okay, Professor Dr. Cian Ahmad, I think I explain your CV, and then you have 20 minutes for explain the topic. So the time is yours.
Can you hear me?
Yes, I can.
Can I handle the PowerPoint myself?
Yeah, you can handle it. You can share screen with your PC.
Okay, everybody can see?
Yes. Yes?
Yes.
Yeah.
You can slideshow, maybe?
Yeah, you can show your PPT so it will be full.
Okay, can I start?
Yeah.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Ada Dr. Budi Utomo, Rektor Universiti Muhammadiyah Lamongan, Vice Rector, Pak Arifah Aris, Dean Faculty of Nursing, the Master of Ceremony, Moderator, speakers, and to all participants. Alhamdulillah, to Allah SWT that all of us are gathered today for this international conference. So first of all, I'd like to thank the University of Muhammadiyah Lamongan for inviting me to be the speaker. So my topic today is COVID-19. COVID-19 in pregnant women. So no one could have predicted that COVID-19 will hit the world hard in 2020. More than 600 deaths, about 40 million people believed to be impacted by COVID-19. In less than a year, every country had been affected by the pandemic. WHO designated as a public health emergent international concern on 30th January 2020, and WHO declared COVID-19 a pandemic on the 11th March. And all this has been confirmed cases, and the death is in all the countries. This is what is coronavirus. CO stands for corona, VI for virus, and D for disease, and is a disease that causes your respiratory symptoms. The causative pathogen, everybody knows, is a novel coronavirus, which is due to severe acute respiratory syndrome. Why pregnant women? Pregnant women due to the impact cellular and the physiological changes. Therefore, the pregnant women are susceptible to the respiratory disease and are more likely to develop a severe pneumonia. Given the prevalence of COVID-19, it is speculated that some pregnant women have already been infected. However, limited data are available for the clinical causes management of COVID-19 in pregnancy. This is the transmission. I don't want to go to depth, but this is how it's being transmitted from coronavirus to the carrier to the human. Yeah? And COVID-19 transmission route is through droplets, direct contact, and indirect contact. In Malaysia, there is 2 tests approved by the Ministry of Health. So therefore, to diagnose COVID-19 in Malaysia, 2 tests. RTK RG is called rapid test kit. This is to detect COVID-19 virus, and healthcare worker collect fluids from the nasal and throat. Usually result is 30 minutes. Once positive, they go for the PCR. PCR means polymerase chain reaction, are used to directly detect the presence of antigen rather than the antibodies. The collect fluid is from nasal and throat. Results can at least 24 hours or about 2 days. The importance of this test, it must be reliable and sensitive. So for Malaysia, it's about 85% the sensitivity. So that's why for Malaysia, we choose these 2 tests. So what are the signs symptoms? So this is the most common symptoms. Usually incubation period is about 5 to 14 days after exposure. You get these symptoms: fever, dry cough, tiredness. The less symptoms: ache, sore throat, diarrhea, conjunctivitis, rash. Serious will be dealing with the respiratory, difficult in breathing, loss of speech or movements. Cases reported. Most of the cases that I got is from China. In Malaysia, we have not reported yet. So 29 cases of COVID-19 during pregnancy are reported, 5 reported. 1 patient was infected in the 2nd trimester and the others in the 3rd trimester. The pregnant woman infected in the 2nd trimester, symptoms of fever, cough, malaise, and dyspnea. The main symptoms of the other 28 patients infected during the 3rd trimester was fever, 89%, cough, 35%, malaria, pain, 14%, and the CT image of the 27 patient showed a very patchy glass shadow in the lung. 3 patients had elevated liver enzymes and 9 fetal distress. In 17 patients who had detailed about their symptoms, all patients received oxygen support via nasal. 14 patients underwent antiviral therapy and 16 patients underwent antibiotic treatment. As a result, 26 patients delivered cesarean, 2 patients via vaginal delivery. All the neonates survived except for 1. It should be that in this study, born has also an adverse neonatal outcome, such as premature and respiratory distress. So the goal of this for pregnant women, if, for example, they've been diagnosed with COVID, is the reduction of transmission of COVID-19 to pregnant women and the provision of safe care to women with suspected or confirmed COVID-19. So what is the feeling in the COVID woman during COVID? We realized that a lot of the pregnant women, when the COVID-19 was announced, they were very stressful and anxious for women who is pregnant, and they were asking where can they go for their appointment, for their regular appointment. How can they give birth? Because in Malaysia, some only they can come. Yeah, so there were some changes to how, when, and where pregnant women attend essential routine checkup. This was the anxiety that they are feeling, and also because of the COVID-19, there was a reduced routine appointment. So some of them was provide home visit and support over phone or by video conferencing. But still they need to attend the appointment. yeah, but with some precaution, or they call standard operating procedure when they come for their follow-up. So what are the effects on the mother? The large majority of women will experience only moderate cough and cold-like symptoms, cough, fever, and breath. More severe pneumonia. 3 symptoms could occur in pregnant women and identified and treated promptly. So these symptoms are identified and have to be treated promptly. Yeah? The effect on the fetus, currently, no such data suggesting an increased risk of miscarriage or early pregnancy loss in relation to COVID-19. No evidence of intrauterine fetal infection with COVID-19. No evidence of congenital effect of virus COVID-19 on fetal development. So this is the recent or the current at now. So how is the antenatal care? For normal pregnant women in Malaysia, they resume the antenatal checkup, but they limit the patient when they come to the clinic at one time. Those with symptoms or symptoms of coronavirus, as I stated just now, they have contact to the nearest maternity clinic or health clinic and arrange for the COVID testing. They should not attend the routine clinic. For positive COVID-19, they have to be hospitalized for close monitoring because they are at-risk patient. They are being hospitalized for 14 days. After 14 days, 3 nasal swab will be taken. Once negative, only discharge. Then a routine appointment for women with suspected or COVID-19 should be delayed, and fetal well-being need to be monitored closely. For care in the labor ward in Malaysia, we minimize the number of staff entering the labor ward. Maternal observation should be continued. Care in the labor should be ideally continued in the same room. So means that birth, their observation, and they give birth in the same room. Continuous electronic fetal monitoring in labor. Antenatal should not be used. If, for example, there's an imminent delivery, can be allowed some spontaneous vaginal delivery, but all healthcare worker needs to wear a full PPE, personal protective equipment, mask, gown, face shields, but recommended the mode of delivery in a COVID-19 will be cesarean section because they don't want anything risk. But if it's an imminent, they want to deliver there and then, spontaneous vaginal delivery will be encouraged. Care in labor, no recorded case of vaginal secretion in the COVID-19, no evidence that epidural or spinal anesthesia is contraindicated in the presence of coronavirus. Waterboarding should be avoided. Postnatal care, literature from China have advised separate isolation of infected mother and her baby for 14 days. If the woman and the infant gave the consent, then they can be together for boarding and breastfeeding. So therefore, this one is depend on the mother. If they want to be together, if they consent, they want to be together, then give to the patient or the clients if they want. Infant feeding, reassuring that 6 Chinese cases test breastfeeding was negative for COVID-19. In Malaysia, women with COVID-19 symptoms, no breastfeeding. Women with COVID-19 without symptoms, breastfeeding is encouraged with the consent, but we have to ask from the parents if they want to breastfeed. So this is Malaysia. Advice to mother, once they breastfeed, advise the mother when breastfeed to follow, they have to do hand washing before touching. Try and avoid coughing or sneezing on your baby. Consider wearing a face mask while breastfeeding. Follow the recommendation for palm cleaning after breastfeeding. Consider asking someone who is well to feed the express milk to the baby. So this is if the break the chain of infection. Here we have to see the break of infection, that is the organism, the reservoir, the exit, how the transmission, entry, and the new host. So I'll break in the next one. So if we want to break the chain or the prevention, this definitely hand washing is very important. Shows social distancing. Yeah, 1 meter from each other is very important, especially also to pregnant women. We also advise them avoid touching eyes, nose, and mouth. Avoid the 3 C's in Malaysia: crowded places, close contact, gathering. We advise the pregnant woman not to go to all these places or crowded places, especially. So if we want to break the change also, we ask the mother stay as the best is possible, yeah, especially when she is coughing, especially the tissue should be thrown in a dustbin, close. Also, for especially pregnant women, no hugging or shaking hands, people. And in Malaysia also, we have this My Sejahtera, where this is the apps. If they should go, they should scan this using this My Sejahtera, so we can able to trace the contact. For pregnant women, the same thing that I was showing just now: wash hands, touching, spacing, cough and into the tissue. If you have fever, they have to seek advice. For the treatment, treatment is debatable. Still, some said treatment is supportive, and in some places they give antiviral or anti-inflammation or supportive support or comprehensive support. So this is some of the medication that is being given, but also in the world, is still people are still debate on this on the treatment. So it depends country to country.
Excuse me,
The
Professor.
survey that they have done
Professor.
on pregnant women. This was I couldn't find in Malaysia, no published, but this was in China.
Excuse me, Professor.
2019. They identified 118 pregnant women. 71% had positive. 34 had suggestive finding on the CT scan of the chest. So this was the age, and this was the symptoms that they have. Yeah, fever, cough. This is the most common. Yeah, they have the symptoms, but a total of 109 had mild disease.
Excuse me, Professor.
Your disease.
Professor.
Yes.
You have a time limit.
Yes.
So
I try
maybe
to go
you can,
faster.
Yeah, you can go faster.
One of them who received non-invasive mechanical. So this was the, but actually I was just trying to stress here that most of the women, they were the one who chose regarding, you can see here that they delivered. They were the one who choose that they want early delivery. So sometimes you can see here that the baby was premature, or they went for a premature induced. They are more scared actually, but no positive result were detected on the neonatal throat swab of the 8 newborn and breast milk. So this was, the present data do not suggest an increased risk of severe virus among pregnant women. So this is important. So far, there's no suggest of an increased risk to pregnant women. So this was an experience, another study on healthcare worker, but not on a midwife, but any healthcare worker. They are actually they're finding this was a qualitative, being fully responsible for patient well-being. This is my duty, they said. The challenges of working, the resilient, they feel very tired because of heavy workload. Psychological experience, they also feeling of negative emotion in the early stage. They feel fear of the disease. The coping, family, they got pressure also from the professional responsibility and identity. Positive information, also they feel actually relaxation at work with the patient. They are confident with the government. Sleep, they have also sleep disturbances among the healthcare worker. 38% of the healthcare worker were suffering from deep disturbances. So gender, so I just skip because my time is very short. You can see this was a frontline burnout, anxiety, depression. This will be shared with you all, this study. Frontliners finding nurses reported high level of burnout. Yeah, so they feel very burnt out, and they have also 40 to 45 nurses experience depression. So knowledge and perception, you can see what are the knowledge and perception of our healthcare worker. So my conclusion here, defeating COVID-19 is a worldwide effort. It's the responsibility of everyone. It's the responsibility of every pregnant woman. It's the responsibility of every country, and it's the responsibility of the world. If we want this COVID-19 to stop, and we want to be back again safe for all of us. So this is my reference. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Sorry for taking a bit of time.
Okay, it's okay, Professor. And thank you for your presentation. It's very, very good. And then for the second speakers in this first sessions, we will see Associate Professor Dr. Hanita Muntabut. Hello, Professor. Can you hear me?
Morning.
Good morning. Are you okay?
Yes, thank you.
Okay, and then for your information, she is a head of nursing postgraduate study program, Containment University, Thailand. And the topic in this morning is about supporting the community management for the surveillance and prevention of COVID-19. And I will share about her CV. Okay, this is her CV. This is personal data of Associate Professor Dr. Hanita. And then it is the address. And now she is in Center for Research and Development in Community Health System, Faculty of Nursing, Containment University. This is education. And then this is employment record. And 2004 until present, she is Associate Professor of Nursing in Community Health Nursing, Faculty of Nursing, KKU, Thailand. And the area research and specialization, there is so many areas, but there is so many about community nursing and primary health care. It is about community and nursing services. And then the social contribution, there are so many social contribution you can read in our screen. There are so many social contribution. And then awards, yeah. She is an outstanding nurse in research from Thailand Nursing and Midwifery Council in 2009. And there are so many awards. The last one is in Sri Sang Walter Award of Outstanding Nurses. And there are so many professional experience too. And the administration, there are so many administration too. And the last one until 210 until present, it is about program director, doctor of philosophy in nursing, international program in KKU. And Mr. Hanita, Miss Hanita, sorry.
Yep.
The time is yours. You have 20 minutes. Yeah.
Thank you very much. I am very pleased to be with you today, and thank you for Muhammadiyah University of Muhammadiyah Lamongan for inviting me to share with you my experience in community health nursing. Today I'm sharing about the community management systems for the prevention and controls of COVID-19 during the past 4 to 5 months in Thailand. Before I have come to the summary of my short remark about the strengthening of the community management system here for prevention and control of COVID-19, we have had what we call online consultation with more than 20 community leaders regarding how they do, what they do during the times of COVID pandemic and the times of prevention and control that Thailand has for the national measures in order that we can control the COVID-19 within our country. So I'd like to share with you my presentation. Can you see from your side?
Yeah.
Yeah, okay. Okay. I have summed up the information from over 20 community leaders who shared with us during the conference, online conference. There will be at least 2 parts of the strategies that the community operate during the COVID.
Miss Hanita,
yep.
Your share screen, the reason your share screen, your PPT.
Yes.
I can see yours. Yeah, I can see your PPT or your presentation. I cannot see.
So you can share my presentation that I have sent to you.
Oh, okay.
Okay.
Yes.
So that I won't worry about that. So please.
Yeah.
But I will continue with my presentation, please. Okay. And there will be altogether 2 parts. Part 1 is the encouraging for full cooperation from the residents or the citizen in the area. We are talking about community in Thailand. We have quite unique administrative structures for Thailand. We have different villages with a size of more than up to 300 or 400 households, and many villages join together, and there will be what we call sub-district level. And the sub-district level right now that I have used as a unit for community management system. And at the sub-district level here, different one,
okay,
not my one.
This one?
Not my presentation, the
Oh,
other
it is not your presentation?
No. The community one. Then we have one sub-district. There may be, you know, one sub-district, there may be more than 7, more than 10 villages together. At the sub-district level, there will be local administrative organization who operate all of the public services, not only in administration, but also in other aspects like health aspect, social welfare, economy, and natural resources, something like that. So at the sub-district level, there will be organization like that. And also on the part of public health, there is the health promoting hospital, where we can have up to 5, 6, or 7 health workers in the hospital. And the hospital is not the hospital, it is the health center, where there is no beds for the patients. It's only the outpatient services and the community outreach services. Okay. Altogether, we have summed up that administration at the sub-district level, there will be, next slide please, there will be establishing, they have established the center for the communication and management. And within the Center for Communication and Management, under the law, the Thailand law, there would be the Disease Control, Prevention and Control Committee at the sub-district level. And the committee would need to be linked with the district disease prevention and control committee, and the district would have to be linked to the provincial level, and the provincial level need to listen to follow the national disease prevention and control measures. So in order to comply with the national measures, the sub-district one need to work together with a closer link with the district and the national, the provincial disease prevention and control committee. So the organization management of the disease prevention and control will be like that. But then on the community part, the second part, there will be area-based management for the disease prevention and control. In the area-based management of disease prevention and control, we have summed up to the 9 strategies altogether. The first one is the establishing of the Center for Direct Communication and Notification in the event of disease outbreak. This one, the next slide, please. This one need to develop as soon as possible or immediately after the announcement of the outbreak of the COVID-19. I mean, the infected cases report in the country. So every community needs to establish this center. And within the center, the team would be built. We have at least 2-level team. The first team would be at the sub-district level, and the second team would be at the village level. For example, if there are more than 10 villages, each village we have their own disease prevention and control team. And this team will be, separated into sub-team. There will be sub-team according to cluster of the household, or there will be sub-team according to the functions of the team, depending on each of the community. For example, one community may have investigation team, home visiting team, or screening team, or the village entry screening team, for example. So it's depending on the community, but at least there will be disease prevention and control teams in each of the village. Then the team will need to be trained right away about the disease COVID-19, the nature of COVID-19, according to the information that provided from the province and from the country. So there would be knowledgeable, about the COVID-19 and about the standard of prevention and control for COVID-19, whether or not is the standard precautions or the transmitted-based precautions, so that they understand how they would react to the situation that they encounter in 24 hours in the community. Then the protective tools or necessary equipment will need to be procured during the early months of COVID outbreaks. There might be difficult to find the protective tools and equipments because there are shortage of those tools and equipment. But for example, masks. So the community get together and organize the housewife groups or other groups, volunteer groups, to make masks so that everyone can have their masks. Face shields or masks will be distributed after production. So within the community, after just a few days, there would be masks for everyone. Then they need to set up the database system so that they can make a report, not only to make a report to district and provincial level, but also to among themselves within the village management system. Second strategy would be disease investigation by the community. This time is the set of activities here would be operate under the Center of Direct Communication and Notification of COVID outbreak. And the disease investigation is made under the recommendation of the national measures. So it has to be done immediately and within 24 hours. And in order to do disease investigation, target population must be identified. And the target population here include those who are from outside the community, because the community know each other very well, and they have household information to whom stay in the community and who stay outside the community and who come from other area, especially those who come from infected zones, the provinces or the area that found cases. Secondly, risk group, including older population and those who live with chronic illnesses and others. So those risk group would need to be identified as well. And the screening for at-risk group or those who are suspected of contacts would be done by the village team. And not only the risk groups, but also the risk location or the risk zone or places, public places that may be risk to spread of the disease would need to be scanned and need to be recorded and, you know, identified in order that they can, you know, negotiate with the owner of those places in order to operate the measures for disease prevention and control and disinfection. And the third strategy will be the adjustment of the plan. Usually in the community, there will be a development plan. And if there is no urgent event like, you know, COVID-19, the plan would be operate in their own, you know, fashion. But when COVID-19, you know, pandemic outbreak, the plan would need to be adjusted so that most of the activity would be, you know, to cover prevention and control of COVID-19. For this plan, it will be operate using the functions of the cooperating units for the plan. Most of the leading organization here would be local government, and they need to work very close with the Tambon or sub-district health promoting hospital, so that the measures on disease prevention and control would be transferred from the district, sub-district health promoting hospital. And the fourth strategy will be community surveillance. The next slide, please. The community surveillance using alerts of communicable disease like COVID-19 at village and sub-district level. There will be at least 3 components here. Assessment for severities, severities of the outbreak, and the management of information, the information for alerts. And the third one will be assessment of the team capacity. Altogether, of the 3 portions here, they need to work very close with the cooperation of the social capitals or the community groups and organizations, so that everyone, when they want to, you know, operate actions in the community, they need to be aware of the fact that COVID might be spread. So every measures or standards that approved at national level would be carried out in the community level, together with the community, you know, innovations, just to avoid the disease spread. Then the fifth one will be the control of disease spread and transmission. This is the work between the risk groups. So those who are in the disease prevention and control committee at the sub-district team or the village team need to have accurate information so that they can communicate with risk groups, in order that the risk group would follow strictly the standard precautions and measures for the disease prevention, the prevention of the disease spread and transmission. So the hard work here is how the team would be able to communicate well with those risk groups, and how the risk group would do to follow the standard precaution or transmitted based precaution, or other measures in order to control the spread and the transmission of the disease. And in order to come to new normal practice, because in cautiously of COVID-19, when they conduct any activity right now, they would do to follow the transmitted-based precautions like wearing masks, keeping distance, hand washing, and eating hot meal, something like that. The sixth strategy will be Committee Code of Conduct. Next slide, please. The Committee Code of Conduct rules and alert. Next slide, please. Here, the committee, most of the committee that we have communicate with, they set the Committee Code of Conduct. First group will be risk group. Second group will be those who operate public services like public space that may be risk for people who get together or for gathering crowded. Then the team of control, prevention and control of disease team. So all of those three groups of people need to work together very hard on trying to follow the Committee Code of Conduct. And negotiation among the committee member is another hard part, so that people need to communicate to each other directly. And the Committee Code of Conduct here work very well in trying to get people protect themselves from the disease spread. Strategy 7, teach and provide information. This one, we need to do, first thing is to identify the target population. And second thing, to filter information, to have the accurate information, most accurate information, no fake news, no rumor, but only strictly follow the information that work, that provide effective preventive measures in order that the spread of the disease will be controlled. And the guideline or the training of those target population would be done, every day, either from medias or
Eto.
Miss Hanita, Mrs. Hanita, please unmute your Zoom.
Okay. And then referral, the next slide, please.
Next slide.
And referrals will be done for proper investigation and treatment. This is very true for committee. Some committee have, to set up local quarantine apart from isolation or control of observations, that they need to do that for 14 days for those who return from outside, or for those who come from infected zone, or for those who are suspected of contacts. But otherwise, they need to refer those suspected infections or suspicious for illness to the hospital at the provincial level, so that they They need to set up the team. They need to train the team for the transportation and ambulance services. So this one is very special because they need to train it very hard. The operator of the vehicle, the operator of the ambulance and transportation need to be trained. And equipment like PPE and others would need to be fully support the transportation. The last one will be, last one, next slide please, will be sanitation and disinfection. This is done for the suspected or the risk places and zones. And it needs to work with owner or operators of the places or the zones. Disinfection would need to be, supported. The disinfecting of those places, including shelter, local quarantine, and observation center.
Ms. Hanita, the
all
time is
together,
over.
put together in one community.
Okay,
So
Ms.
the
Hanita.
guideline and everything would be completed. Okay.
Okay. You can
I'm going
faster.
to finish my
Okay.
presentation in
Yes.
1 minute. That
Okay.
Most of the committee that we have worked with, that throughout the country we have 8,000 community like this, but what we have, the number that we have worked with are more than 2,000 or 3,000. They have social capitals of what we call community groups and organization when it comes to respond to COVID-19 outbreak. They organize among those organizations and join hands together and try to prevent the spread of the COVID-19 into their community. And at the same time, they have organized among the social organization and community organization in order that any problem occur, like shortage of food or shortage of mask equipment for disinfection or equipment for disease prevention, they would join hands and try to, produce some of those if they could. So this is the capacity of the community in Thailand in terms of prevention and control of COVID-19. Thank you very much.
Okay, thank you so much, Ms. Hanita. It is very good to hear about your presentation. And then we will hear the third presentation. The third presentation is from Mr. Dimas Aryanugraha, STR Sains Sarjana, Sains Terapan Kesehatan, Magister Kesehatan. He is a lecturer of Physiotherapy Study Program from Universitas Muhammadiyah Lamongan. And then the topic is the role of physical activity in maintaining the immune system to prevent COVID-19. And before we start these speakers, or before Mr. Dimas Arya start speaking, I will announce that the audience can ask questions in the chat room from YouTube or from Zoom chat room. So you can typing start now. And then I will share about the CV, about his CV. Okay, I will start it. Okay, this is the CV of Mr. Dimas Aryanugraha. Hello, Mr. Dimas, can you hear me?
Hello.
Okay, Ms. Dimas, how are you? Are you good?
I'm good, thank you.
Okay, okay, Mr. Dimas is from Lamongan, from our university, from Universitas Muhammadiyah Lamongan, and then the last study is about Magister Ilmu Kesehatan Olahraga, and then ini data pendidikan ya. It is the education of Mr. Dimas. The last one is Magister Ilmu Kesehatan Olahraga FK Unair. And then this is his clinical experience. Mulai praktek klinik di RS Sutomo sampai sekarang bekerja di Universitas Muhammadiyah Lamongan. And then this is some keterampilan ya, beberapa keterampilan yang digunakan, yang bisa dilakukan oleh Mr. Dimas. And then this is bahasa Mr. Dimas active in two bahasa Indonesia and English. And this is his publication about direct effect of shortwave geothermy therapy and exercise with quadriceps bends against knee osteoarthritis patient with functional capabilities. Okay, Mr. Dimas, the time is yours in 20 minutes.
Okay, thank you. Can you hear me, everyone?
Yes, you can share
Okay.
your minutes.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. I am Dimas Aryanugraha, usually called Dimas. Thank you for joining us in this webinar. And also thank you for our beloved President Rector, Dean, and other speakers for time and place. Okay, now we're going to talk about the role of physical activity in maintaining the immune system to prevent COVID-19. But before getting to the main topic, first of all, we must know about the COVID-19. WHO has announced that on March 11, 2020, COVID-19 is a global pandemic. Whereas in Indonesia, according to Presidensial Decree number 12 in 2020, on April 13, COVID-19 is a national disaster. This is the data per July 2020 of COVID-19 cases in Southeast Asian countries. The first number with black color is the number of cases, and the second number with red color in the mortality number. We can see that currently our country having the highest number of COVID-19 cases and also having the highest number of mortality cases per July 2020. This is a quiet hike between other countries in Southeast Asia. Coronavirus or COVID-19 is an illness caused by virus that can spread from person to person. The virus that caused by COVID-19 is a new coronavirus that spread throughout the world and has caused a major challenge not only for the health system, but also for society. In general, COVID-19 symptoms can range from mild or no symptom at all to severe illness. COVID-19 can cause general symptoms such as fever, cough, fatigue, sore throat, shortness of breath, and occurs for about 2 until 14 after you infected the virus. Okay, we will know how COVID-19 is spread. You can become infected by a person who has COVID-19 from respiratory droplets when an infected person cough, sneeze, or talk. And we may also be able to get it by touching a surface or object that has the virus on it. And then by touching your mouth, nose, or eyes. We can infect it by coming close contact about 2 arm lengths. It is about 2 meters with a person who has COVID-19. I think all of us already know and understand about the spread of and slowdown of COVID-19. So we can start from wash your hand often, when out with your friend, wear a cloth covering, and stay 6 feet apart from others. Clean frequently, touching object, cover your cough and sneeze. Don't touch your face, and stay home if you are sick. This is the timeline of COVID-19 vaccine. We know that until now, there has been no vaccine for COVID-19. But we have to stay positive because by this time, COVID-19 vaccine still in research process. WHO predicted that the vaccine will be ready at 2021. WHO also say that they have several candidates of the vaccine and some of them are now in the clinical trial process. How to maintain immunity during a COVID-19 pandemic? There are some healthy ways to strengthen or maintain the immunity. The first, eat healthy or eat with balanced nutrition. The most important thing is the intake of fruit and vegetable must be fulfilled. And 2, keep your quality of sleep with a minimum of 6 until 8 hours per day. And 3, reduce your stress, fill your mind with positive things, do your favorite activity, and the most important is keep calm during the pandemic. The last, do exercise. In this opportunity, we will focus for the exercise. So, what kind of exercise that can increase or maintain our immunity during a pandemic? The important principle that we should take notes during our physical activity, especially exercise, there are 4 points: frequency, intensity, time, and type. The first is how often you exercise. The intensity is how hard. The time is how long you exercise. And the last type is what kind of exercise you do. In this slide, I want to show the J-curve response diagram that the exercise with moderate intensity can reduce the inflammation and reduce the risk of upper respiratory tract infection. However, when doing high intensity can actually increase the risk of infection and reduce immune system. Means that being sedentary or exercising too much can lower immunity, while something in the middle can improve immunity. So, the key is do physical activity or exercise with moderate intensity. In addition, here is a brief overview of enhanced immune system and open window. After we do moderate intensity exercise, the immune system increases without an open window. However, when after doing high intensity exercise, the immune system increases with the followed by cycle or open window phenomenon as an entry point for pathogen, which is it can be interpreted as immunosuppression, which might last between 3 until 72 hours. So, how do we know that our physical activity is in the moderate intensity? There are actually several ways, but the simple ways is talk while exercising test. Well, when we exercising, try to talk with a friend or talking alone. If you still being able to carry out conversation easily, it's a moderate intensity. But when talking is difficult or fighting, it's a high intensity. And when you can sing while you exercise, it is a sedentary intensity. For all of us, young and old, regular physical activity is important for staying healthy, compared to just sitting around most of the time. Moderate intensity physical activity is associated with better immune function. Regular physical activity can help reduce the feeling of stress and anxiety. The American College of Sport Medicine recommended 150 until 300 minutes per week of moderate intensity aerobic physical activity and 2 sessions per week of muscle strength training. There are some recommendation exercise during COVID-19 pandemic. Aerobic exercise is an activity that aims to increase heart rate for sustained duration. The advantages are for increased lung capacity, increased oxygen flow to muscle and heart, and reduce anxiety. Exercise for 30 minutes with a frequency of 3 or 4 times per week and with moderate intensity, which is 14 until 69% of heart rate maximum. Here are some examples of exercise for aerobic. If you choose indoor activity, put some music on and walk briskly around the house or up and down the strand for 10 until 50 minutes. And dance your favorite music, do an exercise video, and use home cardio machine if you have them.
Tadi kepencet itu kalau ada baru terus.
If you choose outdoor activity, do walking, jogging, or running, and go for a bicycle ride. Strength training is a type of body exercise that aims to improve physical fitness, reduce injury, disease, and increase bone density. Do it 2 times per week with moderate intensity is 40 until 69% of heart rate maximum. Here are some examples of exercise for strength training. Do yoga, squat, push-up, and lunges. Not only adults are required to do exercise, but for children are also required. There are some recommended exercise for children. Under 5 years, all young children should spend at least 180 minutes a day in a variety of type of physical activity at any intensity. Five until 12 years, all children and adolescents should do at least 60 minutes a day of moderate intensity physical activity. This should include activity that strengthen muscle and bone at least 3 days per week. The conclusion is, first, the intensity of exercise must be with moderate intensity. 2, keep your meal with balanced nutrition, reduce your stress, and keep your sleep quality. And 3, stay active within the recommended guidelines. And if you decide to go outside to walk or exercise, look for a place which is not too crowded. Wear the mask. Be sure to maintain at least a 6 feet distance from other people. Bring your own equipment. Don't touch your face, especially your mouth, nose, and eyes before washing your hand. And the last, to take shower once you arrive at home. Okay, I have a quote from Kenneth Cooper. We do not stop exercising because we grow old. We grow old because stop exercising. Thank you. Salam olahraga. Akhirul kalam. Wassalamualaikum warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh. Okay, thank you, Mr. Dimas. It's very good to hear your presentation. And then it is the time for the discussion. I think I read some questions from the audience. The first question is for Prof. Che. Yeah, Prof. Che and Ahmad. The first question is from Nur Amrinatus Solihah, Eskep from Unimus. This question is for Prof. Chean. Okay. The question is, I have read some case here in Indonesia, in the black zone, the city of Surabaya, which is have a high number of infected patients. There is a mother with pregnancy, regularly check up at the hospital, and then she developed a sign that she might be positive with COVID-19, such as cold, high fever, and difficulty at breathing, and later confirm positive COVID-19 and lead to her unborn child death, and then the mother too. Prof. Jane, how do you see such a case and what we could do, especially for a nurse, to prevent this happen again? And also, how about the regulation in Malaysia? Do you have such a similar case there, like that, about the mother with confirmed positive of COVID-19? Okay, Prof. J. Yeah. Can you unmute your speakers?
Yes?
Yes, I can hear your voice.
Okay. Thank you for the question. Okay. As I was telling just now during my presentation, in Malaysia, for example, your case just now, you have a pregnant lady who has been infected with COVID-19. Okay, we do have in Malaysia, but the statistic of how many pregnant ladies is not really very conclusive. We don't have really the data to collect. We have, they always, in the TV, they announce general population, but not specific to pregnant ladies. Okay. Number two, I feel that for pregnant ladies, they must not take it easy. As I told just now, they must follow the precautions or the standard operating procedure. For all pregnant ladies, I will advise, as I said just now, stay at home. Yeah, it's very important. You have two lives there, the mother and the baby. Even though statistics have shown that there's no actually evidence to show that there is effect on the fetus of deformity or anything, but I think we should take precaution, yeah, to the baby and to the mother. And actually done study by the Chinese, by China, even though we say that there is no evidence, but in China, they have also premature baby delivered, and also there was a death. We are not conclusive enough. Is it really due to COVID-19 or is it fear of the mother? Some they want to induce. They don't want to carry the baby. This is what according to the study. They are more fear of the COVID-19 pada anak dia, yang kena anak dia. So dia lebih takut pada virus itu. Yeah. So itu dia, there is no, as I said, very conclusive on COVID-19. So far evidence seperti yang saya cakap, tak ada serious enough nak katakan yang COVID-19 will affect tremendously to the pregnant lady or to the baby. Yeah, it's just the same effect to the general population. Yeah, that is my answer lah. Okay, is it clear?
Okay, it is very clear, Prof. J. Okay, and then about the second question. The second question is for Miss Hanita from Natasha Cornelia, Unika Atmajaya. Okay, Miss Hanita, can you hear me?
Yes, yes.
Okay. The question is, I was interested in your presentation because the situation in Thailand village was quite similar in rural areas in Indonesia, but in Indonesia, a lot of rural residents are not aware about COVID-19 dangers. Do you have any suggestion on how to reach and educate them? Do you think we could apply the same strategies with Thailand? Okay.
Yeah, I have presented 9 strategies altogether that you may have extra time to reach the PowerPoint that going to be shared. But in short, we need to encourage the organization, the community organization to work together first. And because in Thailand, we have health volunteers and we work through health volunteer. Health volunteer work very close with the Disease Prevention and Control Committee. And all of the health volunteers that register with the health promoting hospital and the local government, they are team of the disease prevention and control in the village level and the sub-district level. So through those village disease prevention and control committee and team and the sub-district committee and team, they work house to house information sharing and training about the standards precautions and the transmitted based precautions, and together with the measures that the national set up for the prevention and control of the spread.
Bahasa Inggris sajanya.
Yep.
Okay. Miss Hanita, is it over?
Yes.
Okay. Okay, I think it's very good. And then for the third question is for Mr. Dimas. So I think There are two questions. Mr. Dimas, can you hear me?
Yes.
Oke, kebetulan pertanyaannya in bahasa, saya bacakan dalam bahasa. Ini dari Siti Khotijah, Puskesmas Tangerang. Jadi jika kita sebagai tenaga kesehatan yang sudah lansia, apa yang harus dilakukan untuk menjaga kesehatan agar tidak terkena COVID? Karena usia lanjut yang beliau tahu rentan terhadap virus corona. Kemudian ada pertanyaan yang kedua. Oh, satu-satu. Oke, it is the first question for Mr. Dimas. The time is yours, Mr. Dimas.
Oke, bahasa Indonesia aja nggak apa-apa ya.
It's okay in Indonesia, in bahasa.
Oke, karena pertanyaannya dari Indonesia, saya jawabnya dengan bahasa juga, bahasa Indonesia. Jadi apabila orang dengan usia lanjut itu bisa dengan olahraga cukup dengan jalan-jalan di sekitaran rumah atau bisa jogging kecil-kecil. Jadi cukup dengan 30 menit per hari, itu sudah cukup. Perlu diingat tadi, kuncinya adalah jangan sampai ke intensitas tinggi, hanya cukup di moderate intensity. Jadi apabila kita jalan-jalan atau jogging ringan, itu bisa kita tes dengan kita berbicara sendiri atau berbicara dengan orang lain. Apabila berbicaranya lancar, berarti itu termasuk moderate intensity. Jadi disarankan untuk jalan-jalan saja di sekitaran rumah, tidak perlu keluar rumah. Cukup dengan 30 menit per hari, sudah cukup. Oke, next question.
Okay, and I will explain about the answer. So for lansia in Indonesia, for elderly, you can maintain your health with jogging, jogging in 30 minutes maximal in a day. So it is very easy to it for elderly. And then for the second question, it is still for Mr. Dimas. It is about fitness in gym center. Is it recommended for now? Is it recommended or no, or not now? And how to lower the risk when we use the tools like treadmill or the equipment in there together with the other people. It is from Chandra, Litbangkes Magelang. Okay.
Okay, to Chandra in Magelang, if you go out to the gym, it's not recommended in here now. So do exercise in home, especially just at home, not the gym, because in Indonesia it's crowded. Yang kedua.
Okay, this is about fitness in gym center. It is not recommended now in Indonesia, especially because the high risk and high number of COVID-19. I think it is the last question for Mr. Dimas. And then there is one question for Irsyad. Yeah, for Irsyad. Muhammad Maulana Irsyad from Universitas Muhammadiyah Lamongan. This is question for Mrs. C. Yeah, Mrs. Chean, can you hear me? Still, can you hear me? Hello?
Yes.
Chean? Oh, yes.
Yeah.
Okay. This is question for you. It is from Muhammad Yazid Dwi Cahyo. He is in Saudi Arabia. He want to ask about how about baby born or baby newborn, can he take first milk from mother if the mother is with COVID-19?
Okay.
Okay, yeah.
Okay, thank you so much, Muhammad, from Saudi Arabia.
Yeah.
I've already actually, I also confirm, actually my daughter is also a specialist in ONG. He is working in Hospital Kuala Lumpur regarding whether those with COVID-19, mothers with COVID-19, should they be given. So in Malaysia, according to my slides, those with COVID-19 with symptoms, they are not encouraged. But without symptoms, it's up to the mother. They still have to ask the parents whether they want or not to breastfeed the child. This is because the bonding between the mother and the child, we felt that is very important. So it's still the mother, the parents' decision, whether they want to breastfeed or not. But with symptoms in Malaysia, they do not encourage breastfeeding. That is my answer.
Thank you for your answer. And then for the second question for Miss Hanita. Miss Hanita, can you hear me?
Yes.
Okay. And this is the last question too for you. It is from Irsadil Ibad from Universitas Muhammadiyah Lamongan. Does air conditioner or AC, does air conditioner can cause COVID transmission? If does air conditioner can cause COVID transmission, and how to deal with a community that is not cooperative when extracting data related to COVID-19? It is about the deal of the number data related COVID-19 to. There's two questions. Okay.
I cannot get what you.
Okay.
What question again?
Okay. The first question, the question from. Can you speak again? I can hear your voice.
You can you tell me the question, please?
Okay. The question is about transmission COVID with air conditioner. AC, air conditioner.
Okay.
Yeah. Air conditioner about is it can be transmission for COVID-19?
In the community, when people get together, over 10 people get together, they are encouraged to stay less than 1 hour. So they are not encouraged to stay longer than 1 hour in the meeting. And in the social event, like, the festival, the fairs, the social activity at the home or at the halls, they would be encouraged not to organize for larger than 30 people. So, and not stay longer than 1 hour. So it's depending on the information that the national committee would request for the measure for prevention and control. So we need to listen to the national announcement on the precautions and the measures of prevention of the spread. But in order that usually we would stay together less than 1 hour in the air-conditioned room. and not more than 10 people in one, meeting.
Okay, is it enough, Miss Hanita?
Mm-hmm.
Okay, thank you so much. Thank you so
very
much, all of for all our speakers. It is very good to hear.
Thank you to you
your
also, the
speakers.
moderator.
Okay, you're welcome. And then for the last sessions, I think we will give some certificate virtually. Yeah, we will give some certificate virtually. So for our committee leader, Ms. Firjanti Nur Farida, the time is yours. Okay, I will share screen about the okay. Ms. Firjanti, can you hear me?
Yes, you hear me?
Yeah.
Thank you for the time. This is certificate for you, Professor Dr. Cian Ahmad. Thank you as a participant as speaker on international webinar. Thank you for your time and thank you for your information.
Thank you so much. Alhamdulillah.
Thank you. You're welcome. Okay.
Very good organizing. Yeah,
Thank you.
very smooth organizing, very professional, very good. So I like to congratulate University Muhammadiyah Lamongan, yeah?
Lamongan, yes.
For organizing this conference. Keep up the good work. I realized that Indonesia is very active in webinar in this COVID-19. You actually you're discussing on COVID-19. So congratulations again, Alhamdulillah, and thanks for inviting me, and see you all again next time.
Okay, thank you. See you next time.
Okay, and then the second one.
Okay, next. This is certificate for you, Associate Professor Dr. Hanita Muntabut has participated as speaker on international webinar. Thank you for your participation, thank you for your time, and thank you for your information.
Thank you very much. I'm very happy to join your webinar and congratulate the success of University of Muhammadiyah Lamongan in organizing the events, and this is very good to keep us close to each other so that we can at least share what we have been doing in our country to all of you, and wish you all happiness. Thank you.
Okay, thank you. See you next time. We hope we can meet you face to face next time.
See you.
The third one. The third one.
Okay, thank you. This is a certificate for you, Dimas Aryanugraha, Sarjana Terapan Kesehatan, Magister Kesehatan, has participated as speaker on international webinar. Terima kasih Pak Dimas atas materinya yang luar biasa. Banyak sekali pertanyaan yang sudah masuk yang sangat antusias atas materi dari Pak Dimas. Mudah-mudahan ke depan kita bisa menyelenggarakan international webinar lagi sehingga bisa jadi speaker lagi.
Amin. Terima kasih Bu Vivin. Nanti insya Allah pertanyaan yang masuk bisa dijawab satu-satu lewat WhatsApp group mungkin ya. Jadi ya, terima kasih banyak semuanya.
Okay, thank you. Okay, thanks. We to the moderator.
Okay, and for the second session will be start, but before we start it,
moderator.
Yeah.
We can leave, isn't it? As a speaker.
Okay, it's okay if you want
so
to leave. Yeah, it's okay. Okay. And then for the second seminar session, there will be 3 speakers too. The first one speaker is Associate Professor Dr. Saira. She is a Dean, School of Graduate Studies, Management and Science, University Malaysia. And the topic is about self-medication on self-quarantine COVID-19 patients. Okay, Associate Professor Dr. Saira. Dr. Saira, can you hear me? Please unmute your speakers.
Yes, yes,
Okay.
yes, I can hear you.
Okay. Dr. Saira, are you okay?
Alhamdulillah, thank you very much.
Okay, Alhamdulillah. Okay, and then I will share your CV before you start your presentation. Okay, let's see. Okay, this is the CV of Dr. Sairah binti Abdul Karim, and she is in Malaysia, Selangor, Malaysia, and from School of Graduate Studies. And then the marital status, she's married and from Malaysia. And then about the academic qualification, the PhD on oncology from UPM Malaysia, and then the master in hematology and clinical biochemistry, and the bachelor in biomedicine and pre-university in matriculation science. And then this is administrative. This is administrative from Management and Science University. This Dean School of Graduate Studies, and there is so many administrative. And then the next one is about training and conference and seminar attend. There are so many training and conference and seminar too. It is so many, and you can see in your slide all of the audience. Okay, so we can start our Mr. Saira, Miss Saira presentation.
Yes,
Yeah,
yes.
yeah.
Let me share first the screen.
Yeah, okay.
Okay, can everyone see the screen?
Yes, I can see your screen.
All right. Okay, Assalamualaikum, and very good morning to everyone. First, I would like to thank you to University Muhammadiyah Lamongan for inviting me to this international webinar, especially to the rector, Dr. Budi Utomo, and also to the Dean Faculty of Health Life Science, Bapak Arifal Aris. Right, so thank you very much for inviting me to this webinar, right, to this international webinar, and also welcome to all the participants. So I think let me start, right? This talk, of course, the talk for me is on the self-quarantine. Before that, I just would like to share with you, this is the main campus of MSU in Malaysia. All right, so all right, let's start, I think, on this talk. So basically, this is the outline for my talk, which will be on the current status and trend of COVID-19, then the prevention and control measure, and then the purpose and the significance of the self-quarantine, and self-care during quarantine and the new norms because of the COVID pandemic. Right. Okay. The current status and trend of this COVID-19. It is worldwide. Actually, it is a worldwide public health problem. And on 11 March, COVID-19 has been declared as global pandemic by WHO. Right? And the world communicate through WHO, whereby there is a dashboard which shows global situation of the latest data related to the COVID-19, which is more on the case of COVID-19, which detail on the new cases detected and then cases of recovered and also the number of the death. Right? And this and currently there is no effective medicine to treat this COVID-19, and also there is no vaccine to prevent this COVID-19. And thus, for this reason, restrictive public health measures has been taken, right, by most of the countries, I believe. This is include isolation, physical distancing, and quarantine, with the objective is to reduce the transmission of the virus because of no medicine and no vaccine available currently, right? And this is example of the dashboard in Malaysia, right? In Malaysia, there is daily press conference to update on this current status of COVID-19 cases. So normally, the Director General of Ministry of Health will announce on the new cases every day, and how many in the ICU and how many recoveries, and also reported of death. Right? So this is example. This is the latest. On the 24th July, and the number in Malaysia. We are very happy because the number of cases keep reduced up. Until 1 digit only. Right? And results also have shown that the trend of this epidemic mainly depends on the quarantine and the suspected cases. And the combination of this quarantine practice together with the prevention and control measures such as school closures, travel restriction, and physical distancing, and no mass gathering allowed. Right? This prevention control shows a greater effect on the reduction of transmission, right? So meaning a reduced number of cases which required critical care in the hospital compared with the quarantine alone. So it is very important to have this self-quarantine and also other control measures. Right, so how do we flatten the curve? Right? This is quite famous, I think, a famous graph during this COVID-19 pandemic, right? So if you can see here in this diagram, right? If there is no protective measures taken, right, the number of cases will be increasing until it will burden the, healthcare system, right? It will overloaded beyond the capacity of the healthcare system. But then, let's say, example, in Italy, right, it is the most worst case in Italy because of the rapid growth of cases, right? And in the less of a month, the global number of confirmed cases in COVID-19 doubled up from 75,000 cases in February to more than 150,000 cases in March 15, right? So this is double up, and the growth is very rapid and it is very scary. And we can see in most the news, right, in the international news, the country is within the worst country, COVID-19 outbreak outside of China, right? And most of the patient need to go, have to go without the ICU beds, and hospital also run out of supplies such as the protective personal equipment and other supplies. All right. So, and if we can slow the infection rate can be slowed down if we practice on these protective measures, such as do on the self-practicing hygienic, right, hand washing more frequent, stay at home, and also avoid the crowd, right? All right. So what I would like to share with you the Malaysian government initiative and strategy how to control this COVID-19 in Malaysia, right? So basically, 7 days after WHO announced this COVID-19 as pandemic globally, sorry, Malaysian government has initiated Movement Control Order, MCO, which effective on 18 March. And this MCO has been extended for 3 times. Right? For each is for every 2 weeks when we see the pattern and the trend of the increasing number of the cases. And and after that 3 times MCO order, all right, and our Prime Minister has announced another a strategy. We move into the conditional movement control order. All right, this conditional movement control order, we allow certain industry to be operated. All right, but while for the movement control order, most of the school has been closed. All right. So everybody need to stay at home. But then for the conditional movement control order, so certain industry has been allowed to be operated. And now also Malaysia has successfully contained the spread of the pandemic, and now we are entered the recovery phase. So now we call it that now we are in recovery movement control order, RMCO, and this started on the 8th June and it will end until 31st August. So currently we are in the recovery movement control order, and I believe this strategy is really works because it really flattened the curve in Malaysia. Right? So during this MCO, normally people are not allowed to leave their house except to get the necessary things such as food or medication. Right? Another approaches which practiced by Malaysian to slow down the transmission of the virus is through early border control. Right? We don't allow for the movement from outside to the Malaysia. And also another one is proactive case finding and containment. Right? The measures start with the entry restriction of selected foreign nationals into Malaysia, as well as self-quarantine of Malaysian and non-Malaysian citizens returning especially from the COVID-19 hotspot countries. Right? So it is really works to slow down or to flatten the rate, flatten the curve. Right? So why it is important to have this self-quarantine during the COVID-19 pandemic? So it is really critical as it can slow down the spread of COVID-19. This is proven in Malaysia. This self-quarantine really help to reduce, to flatten the curve of this pandemic, right? COVID-19 in Malaysia. And also during this pandemic, also there are few of posters coming out to support to the country to break the chain of the coronavirus by staying at home. Then we can break the chain, then we can reduce the number of cases, and then we can flatten the rate. So the healthcare system will be on the capacity to treat the patient. Right? And basically, all right, what is self-quarantine actually, right? Basically, it is a restriction of people who have no symptoms or not ill, but then we believe had contact with people with confirmed or suspected infection, right? And also those who are at risk, right? These people need to go for self-quarantine, and medical expert, all right, health expert recommend this self-quarantine is 14 days. And this quarantine can be implemented on a voluntary basis or can be legally enforced by the authorities, especially those who coming back from other countries. It is legally enforced by the authority, right? And it is can be done either individual or in a group or in a community level. Right? Why 14 days? Right? So basically that within 14 days or within 5 days, the symptom will appear, right? And after 14 days, let's say the symptom is not appear, meaning they are free from COVID-19, right? All right. So what is it like to be in COVID-19 self-quarantine, right? Of course, this self-quarantine, right, you need to practice the standard hygiene, right? And you need to wash your hand frequently, right? Of course, standard hygiene, you cannot share, it is not encouraged to share things like towel, utensil with others, right? And you are really encouraged to stay at home and only go to the public when it is really needed, right? Especially for food and medicines, right? And there is also no visitors allowed, right, during the quarantine. And at least, I mean, you need to practice also social distancing, at least 6 feet or 2 meters from other people. Right, and this is a self-quarantine guide, standard self-quarantine guide. Basically, there are 2 steps if you do self-quarantine. Right? The first one is health check. You need to do, to take self-temperature at least 2 times per day, early in the morning and also another one in the evening. And you need to also observe for the symptoms such as fever, respiratory illness such as cough, sore throat, running nose, shortness of breath, and if you have mild flu-like illness such as fatigue, chills, muscle ache, or loss of taste or smell, then you need to record your temperature and symptom in a log, right? So you have the data you record during that 14 days. And for the step 2, if you feel feverish or develop certain respiratory illness, then you are advised to get the medical advice. You need to seek for the medical advice. But then before you go to the hospital, you need to make a call to inform the healthcare provider that you are coming to the hospital so that they are ready, and then you need to tell them you are under quarantine, COVID-19 quarantine. So the medical healthcare provider can ready when they want to receive this quarantine, this patient. Right, so
okay, Miss.
Yes.
Miss Saira, you
Yes.
have 3 minutes more.
All right. Okay, I'll be fast. All right, so how to, self-care during the quarantine, right? Of course, this COVID-19 pandemic, meaning you need to stay at home and less activity, less interaction and exercise, all right? So this will lead to the negative effects such as physical and mental effect. So how to keep healthy at home, right? All right, there's a research done during this COVID, and it is found that 45% of adults feel adverse effect and mental health, and 37% showed sign of physiological distress, and up to 70% felt this period was very stressful during their, during this time. Basically, more on their career, they need to work from home, and this is also new norms for them, right? So how to take care of your mental health? Of course, you need to stay connected with your friends, communicate through email or social media or even video conferencing, and also maybe like webinar that we do now, we communicate and interact with others, so we'll curb the issues. And then you need to maintain a healthy lifestyle, stay positive and also stay informed at all time. Right? And how to keep healthy in terms of diet? Of course, you need to follow the standard practicing of healthy diet, right? To make sure that you have adequate daily calorie intakes, you eat right proportion, high protein, carbohydrate and fats, and you need to drink up to 2 liters per day, and of course a lot of fresh vegetables and fruits. And during this COVID-19 also, there's a lot of posters coming out and give some tips how to do food shopping during COVID-19, because you are not allowed to go frequently outside, all right? So you need to wash your hands, you need to keep distance, and then not touch any food without, especially unless you want to buy the food, right? And avoid touching your face, your nose, your mouth. And it is also advisable you have a limit trip to the supermarket, maybe once a week, right? To avoid in the public, right? And of course, also another thing is how to wash fruits and vegetables. This is raw, right? It is very important also. You need to handle it carefully. You need to wash your hand with soap and water, and then you need to wash the fruits and vegetables thoroughly with the clean water, especially when you eat them raw. Okay, all right, and to differentiate between self quarantine and isolation, right? So self quarantine is for those who are not ill, right? But then for isolation, basically it is a separation of people who are already confirmed infected, and this normally will be in the hospital or care facilities, whereby all this PPE, personal protective equipment, will be used to take care of this patient in the healthcare setting. If you can see in the photo, all right, this is the full PPE to protect the self-care workers, right? So this is example also on the PPE wearing to treat the patient, and also to transfer the patient. Also, they need to have to wear the full PPE, right, and take a lot of precautions, right, to avoid transmission. And this is the sadly one, the most sad part of the COVID-19. I think only, not family member can do all this process. So they also need to have this full PPE when handling the death a patient of COVID-19. And also to doning, or to put up your PPE. And also there is also another part very important, how to put away the PPE, right? This is the step showing. So it is very important also part of it to avoid any transmission of this COVID-19. And of course, there is also the main impact to this COVID-19 worldwidely, right? This COVID-19 has introduced new norms to everybody in the world, all right? It encouraged to have hand washing or sanitize, to bring sanitizer at all time, all right? And to practice the coughing and sneezing ethics properly, all right? To practice social and physical distancing, self-quarantine and isolation when needed. And since this pandemic seems very overwhelming throughout the world, so every individual can show their support and will help to slow down this spread of COVID-19. And by doing your part, it will make a big difference to health and also people around us. So what are the new norms after as impact for this COVID-19? So in Malaysia, we practice this 3C and also 3W. All right, we need to avoid this 3C. We need to avoid crowded places. We need to avoid the confined space, and we need to avoid also close conversation. All right, and we need to practice 3W, which is wash. We need to wash our hands. We need to wear face masks whenever we go, and we need to warn ourselves to make sure we keep distance from the rest. All right, so the same poster also on the 3C to ensure to shows that it is very serious, right, to practice this 3C. Okay? And even in the public also, they always keep this signage to make sure we be reminded at all time, all right, to keep ourselves, right, with others. Right. So lastly, I think I would like to encourage to everyone, right, to stay safe by practicing this new norm. All right. Thank you very much.
Okay. Thank you, Dr. Saira, for your presentation.
Okay.
And then thank you so much. And after that, we will.
Thank you so much.
Yeah, we will listen for the second speakers. And for the second speakers is Dr. Quratul Aini MKes. She is responsible for the quality of management study program at Yogyakarta Muhammadiyah University Hospital. Good morning, Dr. Quratul Aini.
Morning.
Okay, can you hear me?
Yes, my sound clear? My voice sounds clear?
Yeah, it is clear. And then the topic from Dr. Quratul Aini is effective health communication is a key factor in fighting the COVID pandemic. And before Dr. Quratul Aini start her presentation, this is her CV. I will share it for you. Okay. 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 Can you see it? This is her CV. Dr. Quratul Aini, tanggal lahir Jakarta 26 September 1979. And now she is a lecturer in Universitas Muhammadiyah Yogyakarta. And then the address in Sleman. And then it is email. And then about education, the last one is the degree, doctoral degree in Universitas 11 Maret Surakarta. And then for pelatihan, yeah, there is so many some program. And then about the research, yeah, the research, it is about publication. The last one, it is about kepemimpinan Islami dan etos kerja Islami Rumah Sakit Syariah. And then it is for, there is some poster, some book, and some journal. We can see in your screen. And then this is her conference. There are so many conference. The last one is about pelatihan sertifikasi internasional peneliti kualitatif. And then I think it is enough about the CV of Dr. Quratul Aini. And you have 20 minutes in your presentation, and the time is yours.
Okay, thank you very much. Finally, it's my turn. It takes many times to write. Okay, I will share my presentations. Okay, can you see my presentations?
Yes, I can see it.
Okay. Okay, Assalamualaikum warahmatullahi wabarakatuh. The first, thank you very much for the nice time and for the opportunities given to me for sharing and for discussions about the topics that serious outbreaks of COVID-19, that's how in everyone's attack in everyone's. And for the topics today, I will present about effective health communication is a key factor in fighting the COVID-19 pandemic. We'll see why the communication is very important in pandemic era today. Yeah, over the course of months, we know that the everyday life of most people changed from normal to extraordinary around the globe. By the beginning of March, there had been serious outbreaks of COVID-19 in a limited number of countries such as China, South Korea, Iran, and Italy. And then while many other experiences a little off before the storm. People in affected countries understood that the Corona-19 virus might reach their shore at one point. The question was when and how hard it would hit. By the end of March, many governments had other drastic measures. Schools and university campus were shut down, like our university, isn't it? And then shops, restaurants, and companies were closed. And people in many different jobs were asked to work from home, and many were in quarantines. Yeah, there are four topics issue that I will share today about health communication in pandemic COVID-19. Yeah. Once more, why the communication is very important. We know for the basic concept for the communication is the way we interact with fellow humans. It's just not only communicates with humans and interact with fellow humans. Communication is not only talk with somebody and somebody listens to us. It's not only like that. So communication is the way we interact with fellow humans with hearts. Even in the communication virtual like this, the way we get our message across, we communicate with our eyes, our face, and then our bodies, as well as our words and our voice. And sometimes poor communication is the cause of fits and fights. Good communications and the ability to manage conflict in serious outbreaks of COVID-19 effectively needs a skill and one that all of us can learn. I think one that all of us can learn, and that we must learn if we are to be effective in communicating this pandemic. Yeah, there are 4 topics issue that I will share today. For the first question, for the first topics is a massive flow of health informations. The scale of crisis and government's responses have been matched by a colossal flow of information about COVID-19 in terms of 24 hours, 7 days news coverage. Televised press conference provided by both political and leaders and health authorities. Prime-time speech to the people by kings or by presidents or by prime minister or by religious leaders, as well as news analysts, debates, and social media posts. It's so massive flow and of health information. The massive of health information and viewpoints on the pandemic is unprecedented and varied. Yeah. While young people prefer information through we know young people through information through social media such as Instagrams or YouTubes or Facebooks, and older adults are generally informed through national evening televisions, maybe or maybe from newspaper. And for the migrants and refugees, may be more effectively reached by migrant community leaders and news sources from their countries of origin. As the pandemic has developed, the need to provide clear, honest, and valid information to the public all over the world has become obvious. Yeah, once more, honest and valid information to the public all over the world has become obvious. There may be way to prevent a COVID-19 pandemic in this globalized time, but verified information is the most effective preventions against the disease of panics. Isn't right? Political leaders and health experts have a special responsibility to provide us with accurate information and to implement measures that require behavior change to fight the pandemic. However, the near chaotic flow of information, each and every one of us in different roles and with different responsibilities may contribute to improve the flow informations and debate on COVID-19. Yeah, isn't right? Health communication is a key and necessary factor in saving lives during the COVID-19 pandemic crisis. Accurate and well-developed health communication can facilitate how societies handle uncertainty and fear, promote and accomplish adherence to necessary behavior change, and meet individuals' fear and foster hope in the face of crisis. Professionals in the fields of health communication, patient education, and health behavior change a special responsibility to contribute to the spread of this and valid information in the different contexts again. And for how to handle uncertainty and fear COVID-19. Yeah. it happens to us. Yeah, it happens to us. How to handle uncertainty and fear COVID-19? COVID-19 is scary for many reasons. The two foremost grounds for the high rate of fear and anxiety are how contagious and lethal this pandemic appears to be, especially for older people. And uncertainty about COVID-19 and its spread is an obvious challenge for health communicators giving information about these conditions. We simply have limited experience and knowledge, and not just about contagiousness and lethality. We know too little about the mutations, rates of the virus. If herd immunity will develop, I think, like right now, and how much it will protect us. We don't know whether a vaccine will be efficient, and not the least, why the course of the disease seems to vary so much, dependent on age and frailty. Furthermore, the consequence for this is of a society lockdown are likely disastrous for many people. The way from uncertainty to panic may be brave. Communication under such condition is demanding. I will suggest for elements that are particularly important in determining how to communicate health information to the public effectively. You can see on our screens. For the first, it's important to declare openly and honestly what is known and what is unknown, and to stick to the fact as much as possible. We must also acknowledge the temporality of facts as a work in progress. What data we have today will be updated and perhaps modified given new evidence related to the disease and its management. We also need to confirm accurate source of these informations. Given how rapidly things are changing, it is important to be clear that when recommendations change, this is based on new, previously unknown evidence. And for the second, information should be consistent and specific. Even if we acknowledge that there is much we don't know, it is important not to get stuck in vagueness. Research on several diseases has shown that illness uncertainty, a patient inability to determine the meaning of illness related events can be a result of ambiguity, like it's like conflicting, like incomplete or inadequate information, complexity and unpredictability. It's like likelihood or risk of future outcome of the disease. And choose, it is important to provide information in clear, specific. It's not only clear, but specific and ambiguous and consistent language. Beyond keeping the message consistent and specific, also the number of spokespersons should be limited and once more consistent. And for the search, making decisions with confidence and honesty. We suggest that it is important to demonstrate ability to make decisions in a situation characterized by uncertainty like now, with confidence. What's the means of confidence in here? Confidence is signaling ability to feel safe in the situations, and honesty that the decision might prove wrong, but it's just honest. It's just honest information. From a health communication perspective, part of the leadership may be to publicly acknowledge and praise those politicians or scientists and healthcare providers at the front line working to solve immediate problems for the benefit of all, I think. And the fourth, how to handle anxiety and fear COVID-19, it should be acknowledged emotions. uncertainty in illness has been associated with anxiety. And not only anxiety, but maybe depressions and distress, all of which can result in panic and passivity. Rather than the community working together to change behavior in ways that will reduce the COVID-19 risk. Information should therefore be empathic by demonstrating concern and by acknowledge the impact of the situation for the individual and their lives, and not by being aloof or too factual. For the clinicians, will know that these challenging tasks, yeah, sometimes often helped by reciprocal trust. Fear is a natural response in the face of pandemic, and fear doesn't go away by being ignored. If we have to underline this, fear doesn't go away by being ignored, and rather the opposite. Fear is easier to handle when it's acknowledged. And optimistic anxiety suggesting that citizens, people must be anxious enough to take the advice from authorities, to heart and optimistic enough as to feel that their actions make a difference. And for the next is how to promote behavior change, and I will present this lessons from health communication research. After in the pandemic COVID-19 is too many health communication research and too many research about COVID-19. To reduce the risk of COVID-19 in the community, it is critical that we pay attention to optimal methods to ensure behavior change, both on the individual as well as the community level. How recommendations are framed is important to secure adherence. We know from research on previous pandemics that official recommendations are met with skepticism by many people. The relevant behavior change to fight the pandemic are well known by now. Wash your hands regularly. Cook in a tissue in your elbow. Keep distance, social distancing. Clean surface. Don't touch your face. The messages are simple, yeah, but are not necessarily simple to implement for all. It's not only we talk and we command somebody to wash your hands regularly, cook in a tissue or in your elbow, keep distance, social distancing. It's not only like that. The messages are simple, but are not necessarily simple to implement for all. Even if everybody had the correct and the same information, behavior change would still be a challenge, I think. Many of these recommendations require changing subconsciously deployed behavioral routines. This will require communication, raising the awareness actions that are mainly habitual, as well now the way from knowing to doing is not easy. The attention behavior gap has been well documented. Knowing is not the same as doing. Yeah, we must underline this, that knowing is not the same as doing. In the last few weeks, a number of papers and websites have been produced, which might serve as helpful resource for anyone engaged in health communications. So I will briefly mention four recommendations regarding behavior change. They are that I say that all lessons from health communication research. For the first,
excuse me, Dr. Furatul Aini.
Yeah.
You have 3 times more.
Okay.
You have 3 minutes. Yeah, 3 minutes more.
I will go fast. Thank you.
Yeah.
First, for the first, the usefulness of creating a mental model about how contamination works and how this can be prevented. And for the second is behavior change requires not only verbal recommendation, but also real interventions in the environment and even legislation. Why not? That is not enough to advise individuals to wash hands and cough in the elbow. It's just as important to change the environment in a way that facilitates the new behavior. In this case of, for instance, by placing alcohol-based hand sanitizer in highly visible location. Moreover, it's important not only to say don't, not only for once more, not only to say don't, but rather to replace one behavior with another and make the behavior easy. For instance, by building it into existing behavioral routines. The norm of not shaking hands as part of social distancing, for example, and may lead awkward, uncomfortable situation as we have to change routines. But restrictive regulation may also be required, I think. It is interesting to see that the road of restrictive regulation is increasingly being used to promote health behavior change. And for the third, even if citizens are more isolated than ever, in more or less self-imposed quarantines, appeals to collective actions and a spirit of we are in it together. We are in it together are very important to flatten the curve and reduce the rate of infections. For the fourth is maintaining behavior change over time, including washing hands, maintaining social distancing, and sneezing into one's elbow and not touching one's face are important. In particular, when restrictions have last for several weeks of or even months, it's important to acknowledge that transition of initiations of behavior to maintain requires change in uh, in the self-regulation of the behavior. And for the four topics is this is pandemic COVID-19 and health communication is challenge for the clinicians. A final important area for implementation of health communication in the COVID-19 crisis is to consider the challenge clinicians face in clinical encounters with patients, whether in persons or to an increasing extent virtual encounters. Net-based manuals have been developed. We know that by telemedicine. We also need to acknowledge the mental health effect of extended social isolation for many vulnerable individuals. Yeah, it's very important. And once more, the current COVID-19 crisis is a unique situation. Not in the history of mankind has a widespread pandemic been met with such extensive and invasive action from political authorities and healthcare communities. However, the communication around the measure takes can be improved in many cases. And decision making under conditions of uncertainty can create significantly psychological pressure. Decision that healthcare workers will face broadly fall under four categories. You can see in the
excuse me, Dr. Quratul Aini, excuse me.
Yeah, it's just for the last. Yeah.
Oh
okay.
yeah, okay.
Okay, thank you. Yeah. For the mental health challenge for healthcare workers, there are three interventions to address the impact of the COVID-19 pandemic on the medical staff. The one is strategies to reduce specific workplace pressures, and then for supports for the general welfare of the medical staff, and then for the special psychological support service for medical staff. And for the last, you can see in my presentation how we coping with stress during the COVID-19 outbreak like this. Take breaks and focus on the facts of COVID-19, separate facts from rumors. If stress continues to hamper your daily activities, talk to a doctor or someone you can trust. And for the last, thank you very much. For conclusion for today is there is a significant uncertainty for all health professionals and key decision makers in navigating the challenge posed by the pandemic. The impacts of the pandemic on the community and health will be identified over the coming years. I think. Citizens play important roles for this. Thank you very much for the time, and I'm so sorry for the take a long time. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you so much for your presentation, Dr. Quratul Aini. And then the last one, the last presenter is Dr. Apoteker Endang Yuniarti, SSI MKes. She is an apotheker from instalasi farmasi Rumah Sakit PKU Muhammadiyah Yogyakarta. And the topic is the role of pharmacists on practice collaboration health worker in COVID-19 patients. Good morning, Dr. Apoteker Endang Yuniarti.
Good morning. Can you hear me?
Ya, selamat pagi Ibu.
Assalamualaikum.
Waalaikumsalam warahmatullahi. Kabar baik?
Alhamdulillah. Fine.
Okay.
Thank you.
Yeah. I think you have 20 minutes for presentation. And then before the presentation, I will share screen about your CV, and then the others can see it. This is the CV. This is the CV from Dr. Endang Yuniarti or Bu Endang. She was born Pontianak in 1917, and now she is an apotheker in RSPKU Muhammadiyah Yogyakarta. And the last education is program doktoral ilmu kedokteran dan kesehatan Universitas Gadjah Mada Yogyakarta. This is the work from 2016 until now. She is lecturer at S1 Farmasi Sekolah Tinggi Kesehatan Muhammadiyah Gombong. And this is her publication. There are so many publications, and the last one is about rationing for medicine by healthcare providers in Indonesian health insurance system at hospital setting. Yeah, in journal, pharmaceutical journal, management journal, and the others. This is her trainings. There are so many trainings. This is the last training is about. This is the seminar. Seminar nasional peran farmasi dalam praktek kefarmasian dan penanggulangan peredaran obat ilegal di era digital tahun 2019. I think this is the CV, and then the time is yours. You have 20 minutes, and you can share screen. Thank you.
Thank you.
Yeah.
Moderator. But you have to stop. Yes. Okay.
Yeah.
can see my presentation?
Okay. You can slide share full screen, yeah. Okay.
Okay, thank you very much, Miss Isni Lailatul. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
Good morning, all. Good morning for all the audience who joined this webinar, wherever you are, at the most comfort place for you. First of all, I would like to thank all of you for joining this webinar today. It's great to learn together with you. I would also like to express my appreciation and thanks to the Universitas Muhammadiyah Lamongan for inviting me and organizing this webinar. Wish you more success in the future. Appreciation are also given to the previous speakers, especially for the distinguished speakers. Thank you for sharing. This is our hospital, and as a referral hospital, we have treated some patients until July 26. We have treated 11 patients with confirmed positive and 56 patients with probable cases. We call in Indonesia PDP or pasien dalam pengawasan. Okay. This is my presentation purposes. First is the importance of collaborative practice during COVID-19 pandemic. And the second purpose is the role of pharmacists in the management of COVID-19. As we know that words of appreciation, many words of appreciation sent to us, all of health workers around the world, from the many people, include the children, say thanks to us, all of the health workers as the front lines on the coronavirus pandemic. And we have know that WHO has issued interim guidance at 27 May 2020 that multidisciplinary collaborative must be conduct among community workers, physicians, nurses, pharmacists, physiotherapists, and the other healthcare profession to make a decision-making process to address multi-mobility and functional decline in caring for older people with COVID-19. And let's start to what the difference between collaboration and coordination. In collaboration, we have to more work together and to make a decision together. So we have to, in complex situation like COVID-19 patient, we have to work together so the outcome of the patient will be improved. According to WHO definition, collaborative practice happens when multiple health workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care across the setting. Many research have published, and interprofessional collaboration have proven that interpersonal collaboration can improve access to health intervention and improve coordination. Interprofessional collaboration can produce a comprehensive, coordinated, and safe health system that is responsible to the needs of the population. And the collaboration practice can improve efficient use of resources, reduce incidence and prevalence of disability, and last but not least, interpersonal collaboration can increase job satisfaction with reduced stress and burnout of health professionals. Okay, ladies and gentlemen, and all the participants, recent experience have shown us that during the COVID-19 crisis demonstrated that successful pandemic response hinges on highly collaborative practice, but we still need mass evidence to show that collaborative practice has succeeded in increasing the effectiveness of therapy in improving the quality of life of COVID-19 patients.
Kita tidak pernah
So we have
menyediakan pemain di sini.
we have to publish many publication and research that show that collaborative practice can improve the quality of life of COVID-19 patients. And this is the main presentation. The role of pharmacies in COVID-19 pandemic. We have two kind of pharmacies. First, in community practice. In community practice, pharmacists have a role to play in identifying potential patients who could test positive for COVID-19. The pharmacists in community can offer counseling, refer patients to other healthcare professionals, or administer OTC, over-the-counter medication to alleviate their symptoms, like for cough, or for fever, or for myalgia, something like that. In the hospital setting, pharmacists have a play role as a part of the health worker to treat the patient, especially for older people with COVID-19. Pharmacists have the responsibility to review of medication prescription, to reduce polypharmacy, and prevent medicine interaction and adverse event for those being treated with COVID-19. Why we have to work together? Until now, no pharmaceutical products have yet been shown to be safe and effective for the treatment of COVID-19. The number of medicines have been suggested as potential investigational therapies, many of which are now being or will soon be studied in clinical trial, including the Solidarity, sponsored by WHO and participating countries. Therefore, we have to work together. Therefore, the pharmacists have to play a role to reduce the adverse drug related problem. On the other hand, there are treatments that can alleviate the symptom, such as difficulty breathing or fever and etc. They do not address the underlying cause, the virus. The idea is that treating the symptoms will help prolong a patient's life and buy time for their own immune system to kick in and remove the infection. Therefore, as we know that no treatment proven to treat COVID-19 virus, but on the other hand, the patient needs some treatment, some medicine to alleviate their symptoms. So maybe one patient can take inappropriate medication. So early detection of inappropriate medication prescription is recommended to prevent adverse drug event and drug interaction. The safety issues have published from many organizations, include Pan American Health Organization, which is supported by WHO. They send some messages about safety issues. One of them, and the important one of them is some COVID-19 patients, often older adults with pre-existing condition, are receiving multiple drug combination without consideration of possible adverse event and interaction. And many publications about drug-related problem in COVID-19 treatment has been published. One of them, an example from Nature Public Health Emergency Collection, that they state that COVID-19 and drug industry for injury is a problem. Another publication show that chloroquine or hydrochloroquine for COVID-19 will be maybe they be hazardous. And in Medscape, they have an article about drug-drug interaction, which could be imperial for COVID-19 patient. So the message is we have to work together in a collaborative way to prevent drug-related problems and improve patient outcome. I will share my experience in our hospital to all of the participants. One of the case is in June 9 in 2020, a 40 years old gentleman with a background of gout arthritis was admitted to our hospital to an isolation ward after PCR test showed COVID-19 confirmed. He had no fever, no sore throat, no dry cough, no nausea, or severe wheezing and worsening dyspnea. He only complained of pain and swelling in the right leg. Blood pressure 130 per 80 millimeter hygrow. Respiration rate 21. Palpitation 80 with regular. Temperature 37 degrees Celsius. Function of the lungs and heart in normal condition. So we can tell the patient is asymptomatic. He was hemodynamically stable and treatment was commenced with sodium diclofenac, omeprazole, Bicomc, a fixed combination of vitamin B complex, vitamin C, nicotinamide, and calcium pentotenate. The patient received zinc, D3, and chloroquine. At that time, the chloroquine is the standard for COVID-19 in our regulation on June 2020. Over the next 3 days, his laboratory testing showed an elevation of transaminase enzyme with AST increased to 357 units per liter and ALT increased to 351 units per liter. Chloroquine was discontinued and he was treated with SNMG, stronger neominopagency, a high-cost medicine of a glycine-containing preparation. SNMG should be used IV intravenous for 4 days. On the 7th day, laboratory testing for liver function was performed and the results were AST decreased to 58 units per liter, ALT decreased to 208, still high enough. HbSAg and HCV were negative respectively, and anti-HIV HAV was 0.370. After a repeat nasopharyngeal and throat swab test for COVID-19 and on 15 June was negative, he was discharged with home medicine where Bicomc, zinc, omeprazole, natrium diclofenac, allopurinol, and biocurlate. The lesson learned from the case is the patient suspected of drug-induced liver injury due to hydrochloroquine use. In addition to an increased risk in the patient condition, the increase in cost can be caused by inappropriate use of drugs. Due to patient have a high-cost medicine for improve his liver function. Current recommendation from NIH on July 2020 and in our regulation to adopt the guidance and the recommendation. No additional laboratory testing and no specific treatment for persons with suspected or confirmed asymptomatic or pre-symptomatic SARS-CoV-2 infection. The evidence is A3. So the patient above actually they need no need additional laboratory testing or specific treatment because the person is asymptomatic. The second recommendation from NIH, July 2020, because zinc has not been shown to have clinical benefit and may be harmful, the panel and NIH panel against using zinc supplementation above the recommended dietary allowance for the prevention of COVID-19, except in a clinical trial. And the second case that I will share to all of the audience. In April 8, 2020, a 77-year-old man is he is an older patient with a history of CHF, was admitted to our hospital to an observation ward where serologic antibody testing showed reactive. So the patient is older and with comorbidity, CHF. He had no fever, no sore throat or nausea, but according to his relative, since 2 weeks before, he had dyspnea, weakness, cold, and slightly swollen feet. Blood pressure 161 per 19.5 millimeter Hg. Main artery and 37.3 degrees Celsius, heart rate 92, respiration rate 42, and saturation oxygen 19. Laboratory tests showed normal function of renal and hepar. Differential blood count showed that leukocyte 8,040 per unit liter and slightly increase of eosinophil, basophil, and neutrophil. Positive, BTA sputum negative, and GNMN expert negative. Radiology examination of this patient showed impression suspect on description of pneumonia. The medicine which prescribed to him during hospitalized were azithromycin, omeprazole, paracetamol, furosemide, andesartan, vitamin C, chloroquine, oseltamivir, laxative serum, cysteine, and ceftazidime IV for the pneumonia. So the patient take 2 antibiotic, azithromycin, and ceftazidime. After 9 days, he was discharged and took levofloxacin tablet. Previously, the physician make a prescription according to our guidance about pneumonia. The prescription replaced this cefixime to levofloxacin tablet as a guidance tablet and the Comsi tablet. From the case is patient had multimorbidity. Patient have CHF, HHD, hypertension, pneumonia with differential diagnosis. Pharmacists, we have to make sure that the patient gets therapy for comorbid treatment appropriately. In this case, the patient get furosemide and candesartan for his CHF and antibiotic for his pneumonia and levofloxacin. The management of antibiotic pneumonia must be according to guide 19 Dokter for Indonesia year 2000 that therapy antibiotic pneumonia for inpatient and outpatient in this patient is appropriate, is according to pneumonia COVID-19 diagnosis and treatment. So in our hospital, we have to work together to make the patient with COVID-19, with comorbid and with older, we have to make sure that the patient get appropriate medication for the COVID-19 and for comorbidity. In addition roles, if not less important from the hospitalized pharmacies is pharmacists, according to our competency, pharmacists have a play an essential role in reviewing and interpreting of all the information and new data of the medicines under investigation and give those ones for their clinician colleagues. One of our competence is drug services, drug information services. So we have to make information, the current information, and share for our colleagues, especially for our clinician colleagues. And the other roles of pharmacies.
Excuse me, Dr.
Yes.
Endang.
Yes.
Dr. Endang, can you hear me? Your time is over. I think you can faster your presentation.
Sorry, I can hear.
The time is over for your
okay.
presentation.
Okay, and maybe is almost the last presentation. Pharmacies must also support the healthcare team and infection prevention to stop the spread of disease, to aligning medication administration time, convert IV to PO conversion, developing treatment protocol that limit unnecessary nebulizer use to prevent aerosol spread from COVID-19, and in our community pharmacies must educate their patient and the public on effective strategies to prevent efficient and further spread of infection. So the conclusion of this presentation, pharmacists play an essential and unique role within the healthcare team to optimize patient care in the midst of COVID-19 pandemic and new normal area. Alhamdulillah, thank you very much. I hope this presentation is useful for me and for us. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Wabarakatuh. Okay, thank you so much, Dr. Endang Yuniarti, for your presentation. And then for the last session, we will have some discussions. And then, though there are so many questions, but before I read the question, para peserta, all the participants, you can write or you can click the link of the attendance, and the attendance will be shared in the chat box in YouTube or in Zoom chat room. Because if you didn't fill it, you can get the certificate. So please click the link, and the link it will be shared now. Okay, I will share screen about the link, but the committee will be share it too in the chat box. Yeah, this is the link. Okay, and for the questions. Okay, the first questions for Dr. Saira. Okay, Dr. Saira, can you hear me?
Yes, yes, yes.
Okay. The first question is from Erina. Erina is from Universitas Sanggabuana, Bandung. Okay. The question is, what is your response about the misdiagnosis of COVID-19 patient nowadays? And then how to prevent it? Okay.
Okay.
Did you get it?
Yeah, about the misdiagnosed. But currently, our practice in Malaysia, we do the diagnosis based on several techniques. I mean, to confirm the COVID case. The first one are using PCR, and there is also we use kits. But I think in Malaysia, there's no record on the misdiagnosed, as I think the PCR will give the most accurate results for confirmation. So it shouldn't be a misdiagnosed for this COVID-19 if you use that PCR. So normally in Malaysia, we do that PCR. That's my answer for the question. And we also do few replication to avoid any false results.
Okay, I think it's very clear. And then about the second question, it is for you too.
Yeah,
from Hoiriah. Hoiriah is from Andri. The question is, what do you think about plasma donor? Plasma donor for COVID patients. And then what about Malaysia? Is it some research about that?
All right. To my knowledge, Malaysia has been selected to do this clinical trial for plasma donor. But then I think a few patients already donated the plasma and already distribute to certain hotspots in Malaysia. But then I think there's no report the usage of this plasma donor yet, because it is basically this plasma donor, they have high antibody and they will focus, the focus, the preference to use this plasma donor is mostly for those who are really very weak in terms of the immune system. And so far, I think, to my knowledge, there's not yet we don't have any record on this, especially research on this plasma donor.
Okay, yeah. Is it enough? Okay, maybe you can answer more. No?
Yeah, sure, no problem.
Okay. Thank you, Dr. Saira, about your answer. And then the second one for Dr. Kuratul Aini. Dr. Kuratul Aini, can you hear me?
Yes.
Okay. There are two questions. The first question is from Erina Lestari, Universitas Sanggabuana, Bandung. From Sylvie, Universitas Muhammadiyah Lamongan. How to anticipate the stigma in community which states that health workers are frightening and potentially transmitting the COVID-19 virus?
Sorry, can you repeat the question?
Okay. How about the anticipate the stigma in the community which states that health workers are frightening and potentially transmitting the COVID-19 virus to the others? Yeah.
Okay. Thank you very much for the questions. I will try to answer about that. I think the main focus is we have to spread the facts. We have to spread the facts. Anything happens to us, we have a responsibility to spread the facts. Stigma can be heightened by insufficient knowledge about how the new coronavirus disease is transmitted and treated, and maybe about negative stigma for the doctor and how to prevent infection. In response priorities, the collection, consolidation, and dissemination of accurate country and community special information about affected areas, individual and group vulnerability of COVID-19, treatment options, and where to access healthcare and information. So we have to underline this. Use simple language for spreading the facts. And maybe for this area, we can use social media. Social media is very useful for reaching a large number of people with health information and with true information and must be relatively locals with social media. Yeah, that's my answer maybe. So we don't have to fear and keep to spread your facts, spreading the facts, and I think you can spreading the facts with use simple language, and you can use social media for reaching a large number and for the lining the true information. That's all my answers.
Okay. Okay, thank you, Dr. Gorotul Aini. But there is one more question. The question is from Ponco Indah, Universitas Muhammadiyah Lamongan. It is about how to overcome panic in community that is not clearly related COVID-19.
Our panic.
How to overcome panic? How to overcome panic in the community that is not clearly related to COVID-19?
Yeah. Okay. So it is. So my answer is like this. It is related to how to we coping with stress. I think. Yeah. How coping with stress during the COVID-19 outbreak. So and maybe you can. We know the COVID-19 can be stressful. The effects can be both physical and emotional. So we can reduce our stress with take breaks from the listening to watching or reading about COVID-19 frequently, including maybe for we stop hear from social media for little time. And then focus on the facts of COVID-19 and understand the risk to yourself and those you care about, I think. And separate facts from rumors, and I think you have to release yourself with develops your happiness. And maybe if doesn't the information doesn't clear, you can always reach informations with the true channelings. Maybe it's just only from governments or from the social media that you can trust for the informations. Yeah, I think it's the answers.
Okay, I think the question is over for Ms. Quratul Aini, Dr. Quratul Aini. Thank you so much for your answer.
Welcome.
And then the last speakers, there are two questions. The first question is from Hairiyah Nuriska from Anri. Hello, Dr. Endang, can you hear me?
Yes.
Okay. It is about recommendation for consuming chloroquine. Is it consumed by COVID-19 patient who had symptom or asymptomatic patient too? Yeah, it is the first question. It is about recommendation for consuming chloroquine in COVID-19 patients. Is it consumed by COVID-19 patient who had symptom or for asymptomatic COVID patient too? Did you get it? Excuse me, your voice is not clear.
Hello, can you hear me?
Ya. Ya, Bu Endang. Sudah. Putus-putus ya?
Hydrochloroquine and
Mohon maaf Bu, masih putus-putus. Halo?
Mbak?
Iya Bu, agak sedikit putus-putus. Nggak apa-apa, monggo dilanjutkan. Oh ya. Oh. Dengeran ya? Mohon maaf. Ibu, permisi, sepertinya ada yang bermasalah dengan jaringannya. Suaranya tidak terdengar sama sekali. Halo. Dengar. Ini pertanyaan terakhir. Ya. Oke, Ibu. Monggo dijawab saja, nggih.
Current guidance, we forbid to chloroquine for the COVID-19 patient, except in clinical trial. So now in our hospital, we don't use anymore chloroquine to treat patients with COVID-19. But before, maybe a few months ago, we use chloroquine as a treatment like slow absolution to patients with symptoms with a positive COVID-19 confirmed. Can you hear?
Okay. Did you finish answer? Ya. Sudah selesai, Bu?
Ya, halo. Dengaran tidak?
Halo. Alhamdulillah ini jelas, Bu. Ini jelas.
Oh iya.
Oke.
Ya, I will repeat my answer. Before the current guidance of COVID-19 treatment, we can use chloroquine for the patient with confirmed positive COVID-19. But the current guidance forbid us to use chloroquine for COVID-19 except in clinical trial. So in my hospital now we didn't use anymore chloroquine to treat patient with COVID-19. Confirm on probable. Can you hear?
Yes, it is very clear now. And then it is the second question. It is from Universitas 11 Maret. The question is, does a pharmacy technician or TKK has an essential role as much as a pharmacist during this pandemic. It is about the role of TKK. Yeah.
Okay, thank you very much for the question. Yes, of course, as a part of health worker, pharmacy technician have a role to to improve the outcome of patient with COVID-19. As a partner of a pharmacist, we can work together to make appropriate use of the medicine to the patient. Appropriate use, appropriate dispense, and monitoring for adverse drug reaction and from the drug interaction from the medicine with used to COVID-19. Of course, you have you play a role, important role, and you can work together. You can work together with pharmacists and with the other health workers in hospital. Thank you.
Okay, I think the questions, the answers is over. The discussion is over. Thank you so much, Ibu Endang, Dr. Endang Yuniarti, dan pembicara-pembicara yang lainnya. And then for our last session, we will have some certificate like the others. So certificate for the speaker virtually. So please, Ms. Virgianti Nurfarida, the time is yours. And then I will share screen this one. Okay.
Okay, thank you. Thank you, Mrs. D. Okay, this is certificate for Associate Professor Dr. Saira from Malaysia. Thank you joining in this international speaker as a speaker, this international webinar. Okay, thank you for your time. Thank you for your information. It's so useful for us.
Thank you very much to University Muhammadiyah Lamongan for this opportunity, inviting me for this international webinar. Hopefully, we can meet face to face, inshallah. Thank you very much. All right.
Thank you.
Okay, and then this is the second one.
Okay. Next, this is certificate for Dr. Quratul Aini, Magister Kesehatan speaker, has participated as speaker on international webinar. Thank you for your time. Thank you for your information. I hope we can join next time.
Okay, thank you so much for the nice time and for the opportunities sharing about the COVID-19 from various words. I think we have much informations from Malaysia and Thailand. And semoga kerjasama kita, Ibu, sebagai saudara muda ya, Universitas Muhammadiyah Lamongan, dan Universitas Muhammadiyah Jakarta bisa berlanjut ke depan dengan sesuatu kerjasama yang lebih baik. Ya Allah.
Amin.
Terima kasih, Ibu.
Okay, and then this is the third one.
Okay, next this is certificate for Dr. Apoteker Endang Yuniarti, Sarjana Sains Magister Kesehatan, has participated as speaker on international webinar. Thank you for the time and thank you for your information. I hope we can join next time face to face.
You're welcome, Ms. Vidyati. I'm so happy can join with this webinar. I hope we can continue this together to make a better treatment for the patient with COVID-19. Thank you and success for Universitas Muhammadiyah Lamongan.
Terima kasih. Thank you. See you next time. Okay, please moderator. Time is yours.
Okay. Okay, thank you for all speakers. And then thank you too for all the audience or the participant, the committee for joining with us in this international seminar from Universitas Muhammadiyah Lamongan. Okay, for the information about the link, maybe you can catch it. I will share it again about the link. The link. Okay. Okay. You can fill your link. You can fill your link from chat box in YouTube or in Zoom room, and we will be closed it until 3 p.m. Jadi nanti rekan-rekan semua akan ditutup untuk link absensinya sampai jam 3 sore. Jadi mohon yang belum mengisi bisa mengisi, dan ini akan di-share selain di link YouTube. Selain di YouTube juga nanti akan di-share di grup ya Bu ya. Ya, semuanya akan di-share di grup. Sure. Okay. Okay, this is the link. This is the link, and then I am Isnilalatul Maghfirah. If there is a mistake when I be moderator, when I'm moderator in this seminar, I apologize to you all, and I hope we can have some more information and good information, new knowledge about COVID-19, and then it will be good information for us. Okay, I think the seminar is over, and then from now, the committee will say thank you for all of you, all of us who successfully joining this seminar. Dari saya, terima kasih saya ucapkan untuk semuanya, speakers dan yang lainnya, dan partisipan semuanya. Saya akhiri, apabila ada kesalahan mohon maaf, dan akan saya tutup acara ini dengan bacaan hamdalah. Alhamdulillahirabbil alamin. Assalamualaikum warahmatullahi wabarakatuh. Have a good time. Thank you.
Terima kasih semua.
See you next time.
UML. Terima kasih.
Thank you.
Thank you, Isni. It's time for me again. So, ladies and gentlemen, this is the end of our international webinar entitled The Role of Health Workers in the Midst of COVID-19 Pandemic in New Normal Era. I'd like to thank to our moderator, Ibu Isni, and also our wonderful speakers around the world. Thank you for sharing your precious knowledge. It's very like to thank to our moderator, Ibu Isni, and also our wonderful speakers. Thank you for all the committee. Thank you for sharing your precious knowledge. It's very like to thank the faculty of health science and also our wonderful. Thank you for all the committee. Thank you for sharing your precious knowledge. It's very like to thank the faculty of health science and also our wonderful. Thank you for all the committee for sharing your precious knowledge. explains the opportunity of your answer and also our level of thank you for all of sharing your performance. We explains the opportunity of your answer and also our level of thank you for all of sharing your performance. We explains the opportunity of your answer and also our level of thank you for all of sharing your performance. We explains the opportunity of your answer and also our level of thank you for all of
Terima kasih. Udah. Ayo kakak. Ayo tidur Bapak ya.
Panitia jangan keluar dulu ya. Panitia tetap di